10:05. All right, good morning, everybody. I'm going to call to order the Yamhill County Board of Commissioners formal informal session for March 9th, 2023. It is 10:05 in the morning. And Commissioner Starrett, would you please lead us in the flag salute?
Pledge allegiance to the flag of the United States of America, to the republic and
Thank you. Okay, we've got a pretty packed agenda today, so we will move through as expeditiously as possible. Item C is our calendar session. We have several things to go over. Commissioners, I just want to remind you that there is an option today to attend the ODF Forest Land Classification Wildfire first of 3 meetings. So I sent that email over this morning with the information on where to go, but it's at the McMinnville Fire Department from 1 to 4. I don't know if we're going to make it in time. It's possible. But today is the field tour. So they will be doing that right away. So if we're not there right at 1, we would probably have to wait until they get back. So just a heads up on that. And then there's 2 more. The second one is tomorrow. And I don't know if it conflicts with our AOC meetings. It's possible it does. I didn't take a look. I think it's the same time, 1 to 4. And then I think there's a third one towards the end of the month. So you should have that email. Let's see. The one thing I didn't see on the calendar was the gospel mission dinner. I believe we're all going to that on the 18th at Abbey Road Farm at 6 p.m. Obviously daylight savings time is Sunday. And then I think that we have an executive session to discuss calendaring on. Is that correct for next week?
I'm sorry,
Executive session
for,
next week.
to discuss.
Bargaining.
Um,
I don't remember.
I'm not sure we had set a date. We can. I think Jody may have another matter that she may be bringing before the board for an executive session next week related to some surplus property.
Okay. Was it
I'm not
already on
sure that
there?
we're going to be ready to have that conversation by next week, but if we are, we can add it to the other session if she does bring that forward.
Maybe I missed that it was already on the calendar.
I don't think so.
We had talked about the need for one in the next couple of weeks, but
Okay.
I'm not sure it'll be next week, but we'll know more later today or tomorrow. So it's possible.
Okay, so does that work for everyone for next week if we have to have a session? Are you thinking before or after? No.
Probably after.
Doesn't work?
Yeah.
Okay. So is before or after preferable? Before. So if that's necessary, maybe shoot for 9.
9 o'clock?
Yeah.
Okay.
Because I think we do have a land use hearing next week as well.
I think that's right.
So, okay.
Okay.
Okay, so we'll confirm that with Jody.
Yeah, tentatively say 9 o'clock next Thursday.
Okay, anything else to add to the calendar?
No.
Nope, okay. Let's see, item D is public comment. This time period is reserved for public comment on any topic other than an agenda item, a quasi judicial land use matter, or a topic scheduled for a public hearing. We did receive a couple of written comments. Commissioners, you've received those. If anyone in the audience is here to offer public comment on something that is not on the agenda or part of a hearing, please come forward now. And if you're online, please raise your virtual hand. I will hand those out when we get to that item. Okay, hearing no further public comment, we will move on to our department updates. And today we are being joined by our transit director, Cynthia Thompson. Welcome, Cynthia.
Good morning.
Good
Trevor
morning.
Schauer,
Good to see you.
I thought before I started, I would ask first, do any of you have any like burning questions that you'd like to ask me? Anything at all before I start? Because that way I'll cover what you might like to know about first.
Well, the only thing is that we've had an ongoing conversation, and this has been something that for as long as I've been here, I've been asking about the city's contribution to the county's
Yes.
transit system, and we talked about that. At one point, a previous board and I went to the mayor and went to a city council meeting in Newburgh and said, hey, listen, you guys, this is not something you can either choose or not choose to budget. And they were doing that.
Mhm.
And Mayor Andrews said, as we left, he said, I feel like I've been robbed. So he acknowledged that. I just want to make sure we have some kind of policy on how that works, what that contribution, what are those guidelines? And I don't know that we do.
We don't actually have a policy. When I arrived, I was given a little history and of what the agreements were, but they really were verbal agreements. I didn't have anything in writing. When all the cities joined the transit district by resolution, so they're all part of the district. There was an agreement that I was told was that the amounts that the various cities agreed to pay, but the ordinance or the resolutions did not dedicate a certain percentage or amount of funding. So when I arrived, I think Newburgh was paying $18,000, I think McMinnville 20, and the small cities really weren't sending anything. So I just went around to all the cities, met with their city councils and asked if they'd be willing to contribute. Then since then, every year I write a letter to each city, and then I created a little chart where, our costs have gone up pretty significantly, actually. But the agreement that I was told was that all the small cities would pay $2,500 a year, and the larger cities, it started with the 18,000 for Newburgh and 20 for McMinnville. So I just added 5% a year since that agreement took place. And so every year I write a letter and I put in the amount that has the 5% increase each year. And I'd say the last few years, McMinnville, I think, is paying close to 23. I can't remember the exact amount. And I think Newburgh has typically been paying around 18 still. And they missed a year or two here and there, but they did pay last year. And then we've gotten some money. I usually will say in the letter, I tell them what we've been doing, all the different things that are taking place, the value of what they're paying for, because and so let me finish that sentence. So the small cities, I've gotten contributions from anywhere from $1,000 to $2,500 from various cities, Yamhill, Carlton. I don't remember them all, but so that's kind of how the process works, but it's not a policy. And the reason we didn't move to create a policy was because a few years ago, the Yamhill County Transit Advisory Committee was working on coming up with what would be a good local funding source and how should that be handled. So when we developed the transit development plan in 2018, it included a number of different options. You could do contributions from all the cities, and they looked at things like demographics and all sorts of different factors and what would each city be paying. The truth is, if you do it according to like a lot of other peers, it would be a huge jump. I mean, like Newburgh would be paying $200,000 or big amounts. So that's in the plan. You can go look at that and look in the financial section and see all that information. But then we started having discussions about, we really do need to have a local funding source beyond what the county contributes, because we get a lot of grant money. And if we want to continue to get all this federal and state grant money, you have match requirements. I would say within another year, we are not going to have enough, even with the county's money. I would say it'll start to be a problem probably next fiscal year. And that may mean you have to turn away some of the grant funding because you're not going to have enough match funding, local match. Fares don't count as match. So all that counts as match is what the county contributes. Any of the things the cities pay for, so that every year totals grand total with what Grand Ron pays us, and they pay us for actual extension of service. That was an agreement that took place a number of years ago. We get around $125,000 a year. So grand total local, we have about between about $650,000 of local money that can go towards match. And now with the new STIF funding, that you can use that as match for federal. So I have included, that's how we've been able to buy a lot of the buses and do some of the new services that we had planned. We included projects that are basically match dollars from the new state funding. So this is, top of mind awareness for the Yamhill County Transit Advisory Committee, and we are talking about this issue. My opinion is that I think it will be difficult if the structure was that you required all the cities to pay. I don't know if that's really the right approach. I kind of think it would be better to have something else, if it's a fee or registration fee, I don't know, something else where they could come up with a local funding source. But, that's just my opinion, and it's more about a committee and board decision, what I think.
Can you break it down into more of like a project-based request? So, we're asking.
Well,
for-
what I've done, I used to do this, it takes a little bit of time. So this year I didn't do it. I would break out, what is the value of the service
Yeah.
that an area has? So for example, the one I remember, and this may be a couple years old, so don't quote me on this, but I think the value to, say, the city of McMinnville, the amount of service they get, if I look at all the routes, start here and just look at the city of McMinnville, it was around, $800,000. Newburgh's is around $300,000 to $400,000. And I can do that based on hours of service in dial-a-ride, demand response, or a fixed route within those communities. The littler towns are a little more difficult because we might have a route that goes from McMinnville to Tigard, and we pass through Dayton, Dundee, Lafayette. But so how I've done that is I kind of look at what are the total hours of service for that route. What do we spend in dial-a-ride there? Because like Newburgh, we have quite a few dial-a-ride. We had to suspend their fixed route because it's like the lowest ridership routes that we have. But the ridership on the dial-a-ride is good.
Yeah.
And so we have a certain number of hours. So I calculate it with a variety of things. And then we can look at ridership, and with our new kind of real-time information, it's getting better and better till we can get a lot better data on actual people getting on and off. Because what we used before was when we did the transit plan, we actually did, rider surveys where somebody got on board and counted. So that was the data I would use. I'd look back and say, okay, average riders that would get on and off in these cities, and then I could calculate that out for the year. But we're getting to a point now where we can really, I think soon we'll be able to look and say, okay, we know that this many people got on and off in those particular places. But, just getting on and off does, if that town wanted to replace the transit system in just for their city, of course, it would cost a lot more than that because you have
Yeah.
a lot of other things, administration, you got to buy buses, it wouldn't, that's just the cost of the hourly revenue service then it's not a perfect science. It's,
Yeah.
I'm trying to think of everything and calculate it, the best estimate that I can. So in the previous letters, I would say the value to your community is, approximately 700,000 and you're paying, 22,000 or whatever, so that they could recognize that it's a good value. But my main goal, why I did it, was I wanted them to realize they're part of the district. It's not just a county that's demanding this of them. They're part of it by resolution. And I wanted them to have it as a line item in their budget so that they would recognize this is just kind of like you have a library or you have transit, or it's taken a really long time and not everyone has done that. But most actually, I think now, because I've been here, I guess 8 years. And so there's quite a few cities that actually, I think, do have it in their budgets as a line item now. So that's a good thing.
Okay. We have your board report and I have some questions highlighted, but if
Okay.
you want to go through it, maybe I'll just,
Go ahead, answer the question, then I'm not going to go through each line you can
Oh, okay.
read, but
I didn't know if you
yeah,
wanted to go
tell
through.
me what you would like to know first. and
so-
that would be great.
do you have a copy of this
I got it on the computer.
on your computer? Okay. And I think you had one. Okay. So under the operations, it's mentioned that the customer complaints have increased. What is that about?
Oh, I wish I could tell you completely. There's a lot of things going on, so I would attribute it to, we've had to suspend service. There's been a lot of changes with staffing because First Transit's been, having a difficult time finding drivers, keeping drivers, that whole scenario. So whenever that happens, it tends to affect the quality of your service because you have new people, they're learning, even though they go through 50 hours of training, that it does affect customer service. And so I went to look to see how much it's increased. It wasn't easy for me to get that percentage, but I can tell you how we handle the customer complaints. So we typically get them through, like somebody might come in person, they may even come to you. They comes through our website, we get complaints that way. So we have a log and then we identify who's really the right person to answer. Sometimes it might be more of a bigger picture question. Sometimes it's an operational question. So then we direct it to the right person. If it's an operational, which typically it is, say someone gets missed at a bus stop or the bus is early, any of those kinds of things, then they will investigate it, contact the person, talk to them. If the driver did something that they shouldn't have done, then there's usually the First Transit is in charge of all of that. So they do all the hiring, firing, they handle all the operations, maintenance, everything for the operation of the system. And they have due process and systems in place. So they take care of it. But then we always communicate back to the customer. We can't tell them details, but we let them know that it's been investigated and that we take their complaints seriously. So it's very important to me. And so we have weekly meetings with, I call it our transit team, which includes First Transit staff. And we talk a lot about this. And we've actually just kind of revised the way we keep the paperwork, I guess I would say. So it's a lot more detailed so that I know if it was responded to, what was a response, how many back and forths, that sort of thing. So I kind of attribute it mostly to lots of change in staffing. What else?
Okay, so not like, I'm concerned about my safety on,
No,
Okay.
it isn't
So-
really. It typically is things like drivers, that was a stop and they didn't stop. They didn't think it was a stop. So I
gotcha.
actually think bus stop signs is one of the problems. And we can talk about that in a little bit, but that will be helpful. Now, one thing that is really nice with our new real-time technology is, we have cameras on all the buses, so 6 to 8 cameras on every bus, depending on the size of the bus. If an incident happens, we can pull the camera. So when they're doing an investigation, if say a passenger says, oh, this happened and that, the driver did this, whatever, we can pull the camera, look through it, see what really happened and then address it. Because if it was actually a driver error or if it was something else, then we can see. The buses have forward facing cameras. The only way they don't have a camera is rear facing, but otherwise everything else, there's cameras. And then there's also First Transit has what's called drive cam. So whenever that actually tracks driver speed, it tracks all sorts of performance related issues. And if there was ever an accident, it will film it automatically if there's ever a collision of any sort. Or if there was a dangerous situation, the driver can actually push a button and it'll start filming it. So that has helped. That helps a lot with both risk management and actually really understanding. I had a situation that this is probably a good little anecdotal story where I talked to a customer who was very upset, but very, very not yelling, just he had an issue and it was a true issue. And I really appreciated how he approached and he told me a story. And it was concerning to me because it seemed like it was in Hillsborough, last trip of the day. And, we don't have a lot of trips. So if you miss it, you're talking hours where you might not get a trip. And he was on a bike. So anyway, I'm not going to go into all the details, but the bottom line is after I watched the tape, it was interesting because I had everything in writing. I had everything that the supervisor said, everything the driver said, everything the customer said. But it was a really subtle thing that if I hadn't watched the tape, I really wouldn't have understood what happened. You know what I mean? Like, because everything in writing made me think one thing. And then when I watched it, what the truth was, is it was a little thing. There was a driver in training driving the bus. The supervisor wasn't really feeling well that day. So he was sitting in the front seat, not really looking. So, you assume when somebody's in training, they're kind of being hovered over in a way by so I realized he really didn't see what happened. Because I was really like, why, if he's riding there with the supervisor, why wouldn't he notice him? Why wouldn't he do anything about this situation? It's because he didn't really look. And I would never have known that. I mean, he talked, there was a conversation that went on, But that didn't show you the picture. You had to actually see what was happening. So that was a kind of an eye opener for me. Like, oh, sometimes you can have all this information on paper and you still don't really understand what the situation was. So
Yeah.
that was
Okay.
it.
When a complaint does come in, at what point is it First Transit's issue?
Well, that's what we've changed in our system. It used to be we'd all get copied and it was sort of, we didn't, it was a pretty loose process. But now what we do is we identify. I have actually one of my, Eric, who is a program coordinator, have him look through it and we all still get them. So he'll say, this is really belongs to Nick. So then it'll be directed to the operations manager at First Transit and then he will deal with it. Or this belongs to Cynthia. And so we do it that way. But there's also ability for me to see all of them. So if I don't agree, I can say,
Right,
oh,
or to follow
yeah,
up later,
right.
because ultimately our name's on the bus.
right, exactly. I would like to say to you, sometimes, I hope that you could get a direct call and somebody's really upset, bus pulled out in front of me and these people don't know how to drive, whatever. So if you get calls, obviously listen to what they have to say and then just, refer it to us and I'll do my best to get back to you with what happened and how it was resolved. So we are working on it. I do think it's mostly the lack of bus stop signs is some of it, and also a lot of new people. Because it takes a while. Being a bus driver is not an easy job. You have to drive safe, you have to be safe, and then you have to deal with a lot of people who aren't always very happy. But most of the time, I think it goes well. We also get compliments. It's not like there's not,
Yeah.
it's all complaints, so.
So that smart bus technology, is that where the one we were talking about where it's all
Mhm.
wireless?
Yeah.
Okay. The capability.
Yeah.
Okay.
We don't
Great.
have ability at the point, we could, but we don't right now. We're like, say you're on the bus with your phone, we don't have wireless capability for riders to use for
Oh,
their
okay.
phone.
That's what I was
It's
thinking.
more about, like, we have LED signs that tell you the next stop, we have automated announcements that tell, hey, the next, but it's on 15 of the buses, mostly the bigger local fixed route or commuter buses have that technology now.
I'm gonna write down drive cam for my soon to be 16-year-old.
Yeah.
Keep track of his speed. Commissioners, any questions on the operations update?
Just one more question that
Mhm.
has to do with ridership, because I know during the lockdown, we didn't see
Right.
significant ridership, but also we lost revenue because we were going fairless for such a long time. Can you just give us a snapshot of what that's up to now?
So actually, ridership is increasing. It went up from last fiscal year. I think it'll be about almost a 24% increase. That's my anticipated when I look at where it is now, what I think it'll be by the end of the fiscal year. So it's coming back. It's, pre-COVID, we were closer to 280,000 rides and now we're at 180 some thousand. So we still, have a ways to go. We went fareless during COVID because of a lot of reasons, but it helps with not spreading germs. They have to count money, all those sorts of things. And we've stayed fareless because we really need to implement a new fare policy. And our fare system was pretty simple. Nobody hadn't raised the fares ever, I don't think. And so we wanted to we didn't really have a real comprehensive, we don't have a student program, an employer program, or lots of different things. So we thought rather than put all the fare system back, then take it away again and then put in a new one, that I would just do it. Well, of course, it's taking a lot longer than I had planned. We do get the fare loss revenue recovered with COVID money. So the COVID grant has been paying for that up to this point. I did include a project in the STIF plan for the state funding. For those who don't know what STIF, stupid acronyms, they have a State Transportation Improvement Fund. Enough to cover the fare loss until we get the policy in place. So there's enough in the plan that will cover it. And I don't know how much I've actually talked to Ken about this, but I'm kind of a fan of fareless systems. This is my own personal opinion. And there's a lot of reasons why that we don't have time to go into. So what I'd like to do is step one is present that information to you, to the committee. We've talked with it at the committee level, but I'd like to talk to you so you can see what are the benefits and challenges if you had a fareless system, and what would you have to do to recover the revenue, but also how much does it really cost you to collect it? what are all this, there's a lot of factors you don't think about when it comes to collecting a fare, especially for a small system. But here in Yamhill, we had a decent fare recovery, better than most. So I think when things were at, their best, we were collecting $300,000 a year in fare, almost, between 250 and 300. You can't use that as match, but it's a decent amount of money. And so that will be coming to you soon. Probably the next couple of months, you're going to have a little report on, here's the pros and cons. You guys are going to say, we hate that idea. We want you to charge a fare, and then we're going to move forward and do that. But we'll be covered with whatever the fare loss is until we finish that discussions. Oh, and you asked one other thing. No, I guess that covered it, right? Because you asked about the fare loss and ridership.
I just had on the buses and maintenance part, I just had a kind of an observation. It says the 4 midsize buses on order with the manufacturer were canceled.
Yes.
Is that just because they don't have supply?
Yes, I'm glad you're bringing up all the things I was going to point out anyway. So this is, it's not like I'm having a big, long conversation after this. The challenge in the transit industry right now is significant when it comes to supply chain issues. We literally cannot get mid-sized buses anymore. The chassis are going to pretty much, all the bus manufacturers in that range were bought out, almost all of them, by Forest River. And they're pretty much selling the chassis to RV industry because they get more money. That's what I've been told by people in the
Forest
know in the
River.
bus world. And there are still a few van type vehicles that we can get. So basically we didn't cancel it. The manufacturer canceled the order. And now the state is working on revising the grant agreements. We have a pilot project we were going to do, and that's what 2 of those buses that were on order were for. So I've gone and been looking at some other options, and I don't really like the other options, but I don't know. I never really say that very often, but I'm kind of bummed out, to be honest. I mean, we can get 30 foot, 35 foot, like the bigger fixed route, and even minivans are becoming a challenge. So this whole, a lot of smaller communities, they're kind of the workhorse of our bus world is the mid-size. So now electric is promising a little bit, but it's a little more expensive. And I just don't really think the technology is completely there, but we certainly can do like a pilot and get maybe 1 or 2 mid-size electrics that are low floor and ramp and could do local service, but that's not going to solve the issue. So I'll just keep you in the loop on that. But we had that one order on, it was pretty much an order for almost 2 years. And then we kind of knew, we kept hearing rumors, and then we finally were officially notified that was going to happen. The other big thing is, this, but First Transit, which used to be part of a big international company called First Group, was purchased by Transdev, and we just got the official letter last week. It happened a few months ago, but it's official now. I don't know what that's going to do yet as far as like changing our contract or any of those sorts of things, but that's in the works. Transdev was pretty much First Transit's main competitor when it came to things like being service provider for systems like ours. I'm being told that don't expect a lot of significant changes. I don't really know how they're going to handle changing out the contract. And, I'll let you know as soon as I hear more details about that.
I have one more question.
Mhm.
There have been other smaller jurisdictions that have gone to more of a, I guess it would be on demand
Mhm.
instead of large buses
Yep.
that are oftentimes running empty. I know Sandy did this.
Mhm.
I believe they went to sort of a jitney program, and a lot of it was private.
Mhm.
And when I look at the cost of,
Mhm.
the government portion of this is significant. I'm wondering if that would better serve us if we could start to look at that instead of
Mhm.
buying big buses that are going back and forth empty, that are
Mhm.
costing a lot, they're hard to get. And then we've got the labor issues in terms of getting drivers. I think that would be a discussion that it might be time for us to
Mhm.
change it up.
We have been talking about that. You still tend to need vehicles that we can't get because they're either mid or even the vans. The other thing is, in most small communities, this is the short answer to your question, but in most small communities, like say you brought in an Uber or a private type of a Lyft or something like that, there usually isn't enough demand for them to want to be here. So typically how they structure them is they have a contract with the transit agency. And then it's sort of a quasi partnership. So they might help with the software and do things. And then maybe you have some private drivers, but then you run into, there's some things regarding risk and lots of other factors. But then you could also have drivers that were employed by the transit district who would also be doing more real-time on demand. In our State Transportation Improvement Fund plan, I have a project for Newburgh because Newburgh's, I just don't think fixed routes, even if we put in what we had in the plan and had 4 routes, I just not confident it's really going to be great ridership. So we have it in there to do a pilot in Newburgh and look at how, and exactly what you're saying. We could look at what if we kind of manage it, but had software that was more real time on demand. You still have the issue, I think, of drivers though, and probably buses, because I still don't know unless you're using cars, you know, like Uber does. But then if you're doing that, I don't know. There's, you know, it's a longer discussion that we could have, but I agree with you. Things have changed and it, you know, my crystal ball isn't working like it used to. So I don't really know what the world's, I mean, I'm happy to see ridership has gone up as much as it has. And I do still think I rode the commuter route the other day and it was pretty full. I rode it from Tiger and, you know, by the time we got to Minville, it was a full bus. So it isn't, they're not empty. Now you may see them and think, oh, they're empty, but you know, people get on, people get off. And if you looked at the ridership for that whole route, it's actually probably more than you would think. So.
Thank you.
I'm noticing some of that with fire departments too. They seem to be moving, especially in cities, they seem to be moving away from those large apparatus to, we have a fire chief in the audience here, but you know, into something that you wouldn't normally think you'd see the fire department rolling around in, but it's quicker, cheaper, easier for them to get around. So yeah, good point. I can just keep going. My questions.
Yeah,
if
go
that's
ahead. Go ahead. Yeah, go ahead.
take it off here, but so any questions about marketing or anything like that?
No, other than I saw some new signs that are going to be deployed
Yeah.
shortly, so.
And I'll just
the ones
mention
now are
that
starting to peel
the
off.
signs are, actually, we get all the bids are updating bids. We'd actually gone out and got bids on two previous time, but we actually are getting updated bids due tomorrow. And so then we'll probably be ordering those signs and poles. And then now we do have the contract in place with Nelson Agar, and they're going to be finishing up with all the permitting. You know, that took a year. I hate to say this project's like a thorn in my side because I want it to be done and it just feels like it's never going to be, but I think we're close. So probably by summer, maybe phase 1, which is most likely Minville key stops, will have some signage.
Okay. Looks like we have a vacancy on the Transit Advisory Committee. So
Yes, I
anybody
think we have
watching,
One, I think.
I might be interested. Let's
Am I
see.
right about that, Caroline? Did we fill it? I don't know. I can't. I think I was sitting there. I did this from memory. I'm like, maybe we filled it. But anyway, I think we have one opening.
Okay. Is it Title VI Civil Rights Plan? What is
Yeah.
that?
It's a required plan for transit agencies, and essentially it's looks at your operations and makes sure that you're being fair and equal to every, looking out for everyone equally, I guess would be the simple way to say that. And so there's certain parameters you have to do. The board adopted the Title VI plan, I want to say 2000, or an update to it, I think in 2019, but it's just time to do another update. So we're just updating it. There's an element of outreach to make sure that we're reaching out to non-English speaking groups. We have a fairly high percentage of Latino. So I think if it's over 15%, then you have to have all your materials in Spanish. So we do have that. We have all of it. And the website, which is almost finished, will be, it'll really have any language, but priority is kind of Spanish because we have a larger population of Spanish speaking folks.
Okay, so that's something we'll see come.
Yeah,
before
you'll
us soon.
see that probably before the end of this, like within the next couple months, that should be finished. And same thing with the Human Services Transportation Plan, that's underway. We're about halfway finished with that. That's another requirement. We have to update it every 5 years.
Okay. I didn't really have any other questions, commissioners. If you did on the rest of the update, feel free to jump in.
I'm good. I got a hands-on tour yesterday, so good to go.
You got to see the good, the bad, and the
Yep.
ugly, I
Yeah.
think, yeah. I don't think you covered, I want to talk shelters. I think you covered, we got all of our, this is a busy time because it's every biennium, we have all of our grants are due. And some of this has come before you and the state transportation improvement plan. And the state transport improvement plan is a big lift. It's just a lot of work to pull it together. They have a lot of requirements. And so that we're done with all that, thank God. So they're all submitted. They're not necessarily, we don't have the grant agreements yet. They're in the process of getting approved all the way up to the Oregon Transportation Commission. So once that all happens, then you'll have the grant agreements and to approve. And so that's kind of taken up most of our time, really, is all that. But we've been on time on all of our quarter reports. We have to do quarter reports obviously every quarter. I did just get a letter from the state about, I shouldn't whine, but like a whole bunch of more things that we have to track and just like, it never seems to stop. But I'm just getting old. And
So
cynical. What
real
can I
quick, while
say?
we're still on transit, the last Sheridan City Council meeting, there was questions about fares. I just want to make sure with these guys that we're good now and that all the questions have been answered.
Aren't you glad you came today?
Yeah.
Oh. Awesome.
Yeah, I have gotten a lot of people saying how much they like it. You know, the big downside, that it always brings up mostly the drivers and the operational folks is all the, terrible people we don't want riding the bus are going to ride it around all the time. But I would like to say you guys get credit because this is the first system in 30 years that I've been doing this that actually has a customer conduct ordinance that was vetted by everybody and went to all the police department and everybody. And that is very helpful because if you ever chose to go down the path of fareless system, you have a way, you have a means to deal with people who are problematic. And we've only had to use it a few times. We've had a few people and we have the ability to expel them for 30 days. And then I always give them 3 or 4 chances, but we could literally expel someone forever if it was really, really troublesome. So you get kudos. There's a lot of small systems that don't have, and it's pretty comprehensive. It covers almost everything. And I'm really pleased that we have that in place. That's it.
Okay.
Been a while since I've been here. I'm
Yeah,
sorry.
thank
Thanks,
you.
Cynthia.
Appreciate you.
Appreciate it. Okay. So that brings us to item F, which is our work session. We have nothing today. Item G is our consent agenda. Commissioners, we have some minutes on there, some personnel items, some contracts, and also the notice of measure election to the clerk's office for the McMinnville Fire District. And I know we have representatives here from the city and from the fire department if there's any questions. But this is kind of a timely matter. It has to be filed as soon as possible. So if you had a chance to review the summary, I think there were 2 parts, summary and the explanatory statement.
Yeah, correct.
And-
It was the Form 801 and then the explanatory statement that would be attached to that.
Okay,
And that was what McMinnville typed up, right? That had no input from,
No, I reviewed it but they prepared it
Yeah.
and provided it to me.
Yeah.
So
it looks good to me. The only question, as I've talked about, is the submission. The creation of the district is coming from the county. So it'll say this information is furnished by Gamble County Board of Commissioners, which might be confusing to some people because it's
Yeah.
McMinnville District, but that's just how it goes. And that's what Carrie said we need to do. So
that's correct. Yeah.
the dissolution is, that information is coming from the rural board. So all of that information will be furnished by the rural board.
in the
Okay.
voters pamphlet statement.
Yeah.
Okay.
So I just don't want anybody to be surprised when they open the
We're,
statement. and it
we're
says-
one of three statements that are going to be in the voters pamphlet. Right?
This is the explanatory and not. you
Yeah,
know,
these are not arguments either.
Are
in
they're
favor
not
or
pro or
opposition.
Supporter.
This is just the explanatory statement of the
Got it.
measure.
Okay.
Yeah. But there's only two pieces, right?
There's the formation of the new district and the
Formation.
dissolution of the existing rural
Dissolution.
district.
And then the new board.
And then there is the election of the new board members. That's right.
Right. But we don't submit anything for that.
Okay.
We've submitted, I believe, everything that we need to for that already.
So we will make sure we get that rolling today so that they have that. Do I have a motion to approve the consent agenda?
Not yet. So a question on the Adobe license renewals. Is there an increase from last year? Is this just status quo? Is it the same?
I didn't notice that there was an increase, but
I just didn't see numbers from last year on it.
While we're waiting, can we take a break before the old business?
says it's a planned budgeted expense and it doesn't say if it's an increase.
It might take me some time to get an answer. So
Okay.
one recommendation would be if you feel more comfortable removing that from the consent.
Not a
agenda
huge
under
concern of
other
mine.
business.
Ultimately, I'd still approve it. So
Okay, but I can get that
be
information
great.
for you. I'm just in the interest while I'm looking it up, if you wanted to remove that, so you can take action and move on to the other agenda.
No,
item,
totally fine.
or If you're okay, I'll get you
I'm
that
good.
information.
All of these license renewals seem to creep up and they always.
well, and it's software, so I can't go touch it. I
Yeah.
can use it,
Yeah.
but it's hard to wrap your head around $187 per person to use the software, and it adds up quick.
Yeah.
Not like a minivan for transit.
Yeah, licensing, we pay a lot for licensing on an annual basis.
Yeah. Sorry for being new.
Yeah. And some of it fluctuates, so some of it could be, there could be an increase, but then it's also, the cost is also driven by the number of licenses that we're also purchasing on an annual basis, so sometimes that'll fluctuate. Because it's not, there's some licenses that we do buy for every employee, there's other software licensing that it's not installed on every single desktop.
Right. No, and it's
Yeah.
definitely lined out. There's 4 versions for whoever. I don't know who has the 4 fancy versions at $400 some odd dollars. but don't want it. It's fine. It sounds like more work, but
Sorry, I'm one of them with the.
yeah,
fancy
okay.
ones.
Shane's probably like, oh my gosh. I
I'm
have to
good.
admit, when you said not yet, I kind of had to stop and go, because I was ready to keep going.
Yeah,
I'm
I'm good.
So if you're good.
Yep.
We'll just get some clarification.
Yep.
Okay, so is that a motion?
So moved.
All right, all those in favor signify by saying aye.
Aye.
All opposed, same sign. Thank you, and thank you McMinnville Fire and team for coming and being available for questions, and it's been a long road, but hopefully we can get that out to you quickly so you can move forward. Okay, so why don't we take a quick break before we get into old business? We've got some lengthy discussions here, so we'll take a maybe 5-7 minute break and be right back. We're back. Okay. Let's scratch that comment. Okay, we are back in session. It is 11:01. And we are picking up at old business. Item H1 is consideration of approval of a personal services agreement between Yamhill County and Coates Cokes for the development of a fentanyl awareness campaign in the amount of $72,000 effective upon execution through March 1st, 2024. And this is continued from February 16th of 2023. And I believe we have Director Manfred here. Welcome.
Welcome.
Good morning.
Good morning.
Bring me back today.
Morning.
I do have a presentation. I figured it would be easiest to be able to share the information and sort of the broad scope of the work that's happening with some support from some slides. So Ken, I know, is working on getting those pulled up, but as we're doing that, I just wanted to share my takeaways from our previous meeting were a couple of concerns on the part of the board. One of them being really just the urgent nature of what is happening in our community related to fentanyl, and wanting to ensure that what we are doing is reacting at that right level and that right sense of urgency, as well as some concerns or questions around wanting to make sure we're not reinventing the wheel, right? We have, if there are campaigns out there, how is this different? And so that is my goal today, is to share with you information around how this campaign, as we've proposed it, fits into a broader array of things that are happening, including things that are happening now, things that have been happening for the last several months, and as well as things that are longer term as well. And then I also will go through some slides that share more detail around the different campaigns that we reviewed and looked at, and in some cases are using actively, and what was missing and why we want to add an additional element into the messaging that we're providing. So that's what I'm hoping to do today. Thank you, Ken, for pulling up the slides. If you go ahead and this. Okay, so this is some information around our immediate response. These are things that are happening currently. They are things that are happening and have been happening for some time. So as we were beginning to see an increase in overdoses, which is information that we have some insight into from our public health data sets that we're able to access, although there are some challenges there, and I can speak to those in a moment. But when we started noticing increases in overdoses, we did stand up a naloxone distribution and training program through our public health department. It was not easy, took a lot of effort, but it is up and running now, and we are able to distribute naloxone to organizations who want to have it on hand. This includes places like schools, businesses, community-based organizations, places like that. To date, we've distributed over 700 doses, and we've trained over 200 people in how to administer naloxone if they are needing it. At this point in time, we're not giving it out to individuals, only organizations, entities, but we do partner with community-based organizations such as Provoking Hope to ensure that they have a supply that they're able to give people, and then people are also able to get it through prescriptions from their providers and things like that. We've been doing mobile outreach. So a lot of that has been done through our behavioral health teams, largely to the highest risk populations that we know of. That's working through places like our syringe exchange, working through our peer support workers and the people that they are encountering in the community and things like that. We've created and sent out a lot of messaging related to just overarching safety. Some of this we've used, and I use one example. The One Pill Can Kill is a campaign that we'll talk a little bit more about right now. We've been using that messaging, as well as creating some messaging that we couldn't find but needed really quickly around safe handling. Folks like our law enforcement agencies and people were looking to us to provide some direction on, when they go out on a call and they see something, what is the appropriate way to keep them safe and to still, collect that. And then we stood up postvention after an overdose occurs. And so some of you may be familiar with postvention. Typically that when we're talking about postvention, it's in relation to a death by suicide. And when that happens, we have teams that can do outreach as long, it's completely voluntary, but we work with law enforcement, we work with DA's office, and then can connect individually with people who may need some more support. This could be the person who overdosed, this could be their family, friends, loved ones, and people who may be trying to grapple with what's just happened. And so being able to go out and support them in that process. And then we have been able to stand up walk-in treatment access for substance use disorder in our clinic. I want to be really clear, you can't come in and get absolutely every single thing that happens under the HHS umbrella with these walk-in services, but you can meet with a peer or a case manager and get the process started. And sometimes that looks different for everyone. Sometimes that can be the person is really needing immediate support for housing. It could be immediate support for getting food, right? And the goal with this walk-in access is to meet someone where they're at, create that relationship, and really hope that you can continue to build that relationship and get them into treatment. And for some people, that's what they're there for, and that's immediately where we start and get them enrolled and begin that process for them. Go ahead, Ken.
Couple quick questions. So is that our adult population, or is that a combination of adult and youth population?
For walk-in treatment?
For the first slide and kind of what you covered there.
Good question. So I would say it's a little dependent on that. So, in terms of like naloxone distribution, we partners have been schools. So all of our schools now do carry that, and they are getting that from us. And so that is related to the youth. The mobile outreach, we don't have an age range on that. It typically ends up being more the adult population, but certainly there's nothing that would prohibit us from engaging or doing outreach to youth. In terms of the walk-in treatment, the person is stationed at our adult behavioral health clinic, which is where we see the largest need. With that said, we certainly would do everything we could to create same-day access if at all possible, if someone is needing that in our family and youth program as well.
Okay. I did hear of a bill in Salem that would boost the amount of naloxone available. It would also make it available to anyone. So just an average person off the street can come in and get it from whatever distribution point, trained to use it, and then also would remove the liability, any civil or criminal liability for that person. Is that something that public health supports? Is that something that we should support and weigh in Salem?
It's a great question, and thank you for asking. Yes, absolutely. We support all of those things. I think one of the things that we learned when we were trying to stand up the distribution program was it was really challenging, and there was a lot of red tape, if you will, for us to even be able to get access to it. And that's just one layer of getting it to people who need it. And so anything that we can do to increase the ability for people to easily access it, I would certainly be supportive of that.
Okay, thank you.
Yeah.
Chair, I have a question real quick. Messaging, under what, where is that messaging? Is that typically your Facebook public health page?
Yes, and I will say, I don't think that there are a lot of youth probably following the public health page. So knowing that, we really try hard to work through our partners. So creating social media posts or finding social media posts and sharing them with places that have more interactions with youth, that may have more youth following them in the example of social media, pushing information out through schools, things like that. So I think it's trying to approach it from as many angles as we can, knowing that different places and different types of messaging are going to connect and resonate with people differently.
So that's being done in-house. So we have the capacity to get something out to the
Yes.
schools or youth
Right.
or youth outreach, for
Mhm.
instance, and
Yes.
and is that, because I know, when we look at our county Facebook information, it's not real exciting. It's not really attractive to who perhaps we want to get to. So is that messaging different
is the messaging like to well, at this point in time, we have really just been adopting, the like one pill can kill. So things that have already been developed and asking partners to share it out
Okay.
and sharing it with partners to have available and things like that.
And they're receptive to it. Schools
Yes.
and everybody's
Yes.
receptive to taking this and using it.
Yes, that's been my experience. I mean, certainly we're not tracking to see what ends up going out, so we don't have a mechanism for that. But people are certainly engaged in conversations and asking for support. And that's my impression is absolutely yes.
Okay, thank you.
So these are some of our short term. So those were like immediate. Those were things that we said we need to do this now to save lives. These are our short term goals, and these are things that are currently happening right now as well. So or short term strategy, excuse me. So school trainings and events, we've been working on these. It's just a picture from one of them. It's a little blurry, but one of the folks sitting there is our public health manager who actually has a great history and experience in prevention work. Up there is one of the panelists, and we're working with other schools to get things in place as well. So those schools, events, trainings for staff, trainings for parents, trainings for youth, community partner and community-based organization trainings, resource information sharing, right? We're trying to pair the information around this is dangerous with what can you do, so trying to do those things in tandem. And then we're really working hard to update our overdose response plan. Public health has had an overdose response plan for a couple of years now. And there's lots of reasons we have not been able to get great partner engagement historically, but we are now, right? It's at a level now where we are getting a lot of engagement from our partners who we want to be part of this plan. And so this is a really great time for us to capitalize on that and update that plan so that it can feel more community centric, more responsive to the situation today that looks different than, say 18 months ago, certainly 2 years ago. So those are all things that are currently in process as well.
So the school trainings, and
Mhm.
and I'm just going back maybe a year or so since this issue has really come forward with some level crisis level response necessary. But we've only heard about really Newburgh having a very comprehensive fentanyl education program recently. I don't know of any. I have kids in 2 other different school districts. I haven't heard of anything going on. Are you aware of any of those?
I know that there are 2 other districts that we're working closely with to put something on. One of them at least has a date scheduled.
Okay.
And the other one, I don't know if there's an actual date scheduled, but we are, working to do that and being as responsive as we can, knowing that our school partners have a tremendous amount of challenge with their own capacity as well. And so we're all, I think, doing the best we can. We do work really closely with almost all of our school districts. And so we do have a meeting coming up this month where I'm hoping that we can get even more of this happening and try to understand what would be most helpful from us. I think that's the other piece, right? The schools certainly may be doing a lot of other things that we're just not involved with as well, which is okay too. That's fine.
Yeah, I was going to ask you if you were aware of them doing anything independently.
Yeah.
If they had self-reported that.
Sure. I mean, I think whether it's a symposium like Newburgh did, that may not be happening, but I do think that there is a lot of conversation, a lot of messaging to teachers about, things to be aware of, what they can do. We've done a lot of training in all the schools around the naloxone and signs and warning signs that they should be looking at and things like that. So that is absolutely happening. But these bigger sort of symposiums, if you will, are things that are in the works in many places.
Okay. I'll get to that a little bit later and some ideas around that too, but
Sure,
let's keep
absolutely.
going.
All right. That's good. Some midterm strategies. So I'll come back to this when we talk specifically about the campaign, but this is really where we see the campaign fitting in. It's this midterm strategy. It's these are things that we want to begin doing now, but they're not happening right now, but we want them to be. We're going to work towards those things. These are wanting to make sure that we have, in addition to the safety message, in addition to those pieces that we think are important, we also want to have more help-seeking messaging. And help-seeking messaging is really based in prevention science around how do you get someone to go from this phase of I know that there's a problem, or I know my friend has a problem. What do I do? How do I take that next step? And it's again, based on science and what we know of what helps people move through those different stages, and wanting to get more messaging that is targeted towards youth for this. And again, I'll share a little bit more about the campaign when we get there. We want to improve our data collection capabilities. I mentioned earlier that public health monitors overdoses, but the data collection has been the source that we have tends to be very delayed, which means that we don't have the opportunity and the ability to move as quickly as we'd like to when we begin to see a spike or trending increases. And so we're really trying to figure out how we can resolve those issues so that we can be more proactive in how we're managing this. And then improving communication about local resources. This is an ongoing challenge, I think, no matter what we're talking about, right? Resources change, things evolve, and sometimes messaging is just really difficult. So this is an ongoing piece of work in pretty much everything we do within Health and Human Services, but just calling it out specifically here as well. And then I would, not be myself if I didn't mention these long-term strategies, which on the surface look like how in the world are they preventing overdoses? But the reality is that we know that these upstream primary prevention programs that begin when people are pregnant, that begin in early childhood, really do have tremendous impact on alcohol and drug use throughout adolescence. And so I just wanted to point these out. These are programs that we do use throughout our community, and they have decades worth of research that shows that they really do prevent alcohol and drug use and tobacco use and all sorts of other really great things. Okay, so existing campaigns. So I've got a few slides. I'm not going to go into detail just for time's sake, but I'm absolutely, if there's specific questions about any of these, we can dive into it more deeply. But I'm going to walk through the campaigns. I think there's 6 of them really quickly and just share, like, these are ones that we're using. These are the pieces that are highlighted in these, and then we'll talk about the proposed campaign through the contract. The first one is One Pill Can Kill. This is one that we have been using. It is focused more on parents, but I think can be adapted pretty easily. It talks about the facts, and it really, a lot of it is around, one pill can kill, right? Trying to get that message around that this is serious. This isn't like other things that we've seen, and how to spot pills that might be fake, and really messaging to parents around this is how people are accessing them as a way to help prevent them from getting them. This is another campaign. This one is based out of Idaho, also parent focused, really leads with some, the really gut-wrenching stories about people being lost, includes facts about fentanyl, includes signs of an overdose and sort of what you would do if you had naloxone, and what you could, how you would administer that. And then it also has information about naloxone and where to access it, but it is Idaho based. And so there's some differences there, obviously, because we have different rules and it's not based on local resources. Song for Charlie. This one is one that I think has been embraced by a lot of school districts. It's teen and parent focused, and it's quite comprehensive and includes a lot of information that is geared towards schools, but again, could be adapted. I mean, it's a little bit more curriculum based. Talks about fentanyl. It has really good information about healthy coping tips, which I think is one of the reasons I know our team likes this one a lot, because it incorporates some of that, which is helpful. And then some just really concrete resources for schools. And this has been shared with our school districts but I can't speak to any of our districts that may or may not be specifically using those tools, but they have them available. The Real Deal on Fentanyl. This one is really focused on youth and young adults. I will say it's not my favorite. Anytime we're working with youth, I don't like to use skull and crossbones. If you've worked with youth, that tends to be a cool thing. And this is not what we want, right? We don't want to have the image of, don't do this in a way that is like, I want a sticker that has that to put on my water bottle. So this is not my favorite. We have not been using this one for those reasons. And what we do like about this, there is information around how to help your friends, but I will say it's less about how do you help your friends kind of in a healthy way to get to sort of a treatment or talking with an adult. But if it does have information about sort of from that harm reduction perspective around not using alone, test strips, things like that, that in some populations is helpful and can save a life for sure. But the imaging in this one is not our favorite at Public Health. This one is called Fentanyl Aware. It's from Lane County. It's pretty generalized and pretty focused on sort of the immediate response around, this is how you would spot an overdose. This is what you could do. And then similar to the previous one, messaging around harm reduction and, things like, how, if you're going to use, how to keep yourself safe. I think this might be the last one. Laced and Lethal. This one is from King County up in Washington. It's also teen and adult focused. And like the similar other ones, it's really focused on sort of overdose, what do you do, and how to keep yourself safe if you are using it, or what are the best ways you could reduce your risk if you are using. Okay, so the campaign contract proposal that's in front of you, as I mentioned, this is really what it falls into those midterm strategies. We're already doing all of the things that came before that, but these are areas that we've identified as gaps and we're working on trying to fill. The funds that we intend and plan to use if this was approved are one-time funds that we have to spend by June 30th. They are alcohol and drug prevention funds, and so it's really the work that we use them for has to be done within that parameter, within the parameters of alcohol and drug prevention. This campaign does not include, it doesn't use up all of those dollars. And so some of the other things that we are looking at for using these funds for, and this is where, again, like I would love to hear some of the ideas, and Commissioner Starrett, you and I have had some conversations wanting to have some youth focused events that are hopefully fun, people want to come to, and we can use these funds to have some incentives to get folks there, whether that's some swag or different types of things that we hope will draw youth into these, and we would have them be age appropriate, high school different than like middle school, just and really we would hope to work with the schools. That's where the audience is. So we've got some thoughts around that and how we might be able to do some more of those things with these funds. We're also incredibly concerned about youth and alcohol use in our county. Our data is showing that our binge drinking rates for 11th graders are significantly higher than the states, and it has us really worried. And so we're also looking at what can we use these funds within the short parameter that we have to spend them that might help support something in that area as well.
Question.
Yeah.
Is that binge drinking? Is that self-reporting? Because, kids tend to be, hey, yeah, I just had a 6-pack on my lunch hour.
Sure.
I mean, are they is it sort of like
Yeah.
bragging type behavior?
Well, I can't speak to that. I can say they are self-reported. The surveys are self-reported surveys, although they are validated questions, meaning they've gone through sort of a research process that shows that the majority of times when these are asked in this way, the answer is an accurate answer. So they're validated questions, and yes, they are self-reported. I will say we've seen an increasing trend as well. So which leads me to think that it's likely accurate as we're seeing this sort of slow, gradual increase that obviously trending in the wrong direction for us. Yeah. So I shared what the existing campaigns out there were, at least the ones that we reviewed, and tried to get a sense of does this have what we need? Can we just copy and paste? Because of course that's ideal if we don't have to reinvent the wheel. So we're still using, like I said, some of those pieces, but it was really the element of help seeking behaviors where we felt there's a gap in what's out there right now, and we are wanting to fill that gap. We've got great resources and information around the dangers of fentanyl, around what to do in an overdose. And then there's a lot of information around harm reduction and the sort of messaging related to if you are using, these are things that will help you be safer. I'm not going to say safe, right? Because it's a tremendous risk, but things that will help you be safer. And so it felt like there was a lot of information on both ends of the spectrum, and what we were missing was that help seeking component. And so that is really what we are wanting to use this campaign for, to fill that gap. And incorporate into it our local resources so that if someone sees this information, they know what to do in Yamhill County, right? Not Lane County, not Multnomah County, but in Yamhill County. What can I do? Where can I go? Who can help me? And so those are the pieces that again, there was a gap. Oh, I think there's one more slide. Yes, last slide. So one of the pieces was to go back and see if we could change the timeline. So they were pretty clear that the building of a platform for the website, they couldn't condense that timeline. That couldn't be condensed. However, what they did do was create 2 different phases of the work so that as they were continuing to build the website earlier on within this process and this timeline, we got access to the sort of print and social media components. So like the toolkit. So we would get those, and the contract doesn't have the little lines where you can see on this slide where it shows this was added, but it just got bumped up several weeks so that we would have access to those things. We could begin using them while the contract continued and they completed the platform. So I'm happy to answer any questions.
I have some
Um,
questions.
Okay, let's start with Commissioner Johnston.
Okay. Is this its own standalone website, or can it be integrated into Yamhill County's HHS website?
It is a standalone cloud-based site that they build and then give us all the rights to, and then we can update it. At some point, the county is going through a process, right, to identify a new platform. My hope would be that we could just incorporate all of this into one platform at some point, but I think I don't have a timeline around that. And our existing website has the public health one, which sits on a different, or the HHS one sits on a different platform than the counties, which is why it has a little bit different feel to it. And we'll remedy that when we get the new contract and that process happens with IT. But right now, that HHS website is quite limited in what we're able to do in terms of infographics, in terms of getting things up there. So it's really hard for us to make a website that is at all youth friendly. And so our hope is that this will do that.
And so will it be integrated with the HHS website to where we kind of get a twofer to where it kind of is upgrading our own website already that needs to be done? Or is this like, it is just 2 totally separate deals and it will not be connected and intertwined? Because I guess, and a follow-up to that is, once this website is, or if it is completed, who's going to manage it? Who's going to update it? What's the cost associated with that?
Yep, great question. So how I imagine it is if someone were to go to the Yamhill County website, that there would be, and they were, on a page that was about alcohol and drug treatment or prevention or something like that, there would be information that they would just link to, and it would just take them to that site. The hope is that we could also get our partner organizations to do the same thing. So if someone goes to another organization, particularly an organization within the Behavioral Health Regional Network, which are the Burns funded through Measure 110, that we would all be able to act, that everyone would have that. So all of those organizations would have that, and we'd be able to have that single repository of again, where do I go if I need help in Yamhill County? In terms of the upkeep and maintenance, we do have a staff member who, as one of their many duties, is to maintain our existing website. And so this would be part of their responsibility. And we also have staff who really work closely with those burn partners. And so we would be actively trying to make sure that any of the information that they had was consistently updated as well.
Is there, do you know a rough cost association? I mean, are we hiring a whole nother person
Oh,
to
no,
keep
this
this?
is existing stuff. We're not
Okay.
adding any expense to the maintenance of that. Yeah,
Okay.
so really the cost is the development. We will absorb any of the future upkeep costs based on just the existing job duties within the department. Is that all your questions?
No, I have way more, but go ahead.
There's way more. Well, keep going. It's
Okay. So on your slide 3 that you had there, for the midterm strategies, it seemed to me 1 and 3 were more geared towards advertising, not necessarily a website. So what I'm struggling with is we have $72,000. It sounds like it can be used towards advertising versus building a website
Yes.
from where the monies came from. It sounds like, I mean, your websites that you had for examples, I had 3 or 4 that weren't even those. I mean, so there's more on top of that. The Get Smart, Just Think Twice, which they're actually connected somehow. They're just labeled differently. There's one from DEA that has like different links and different podcasts that you can click through. And the update was actually on Narcan, which is not effective against the
Tranquilizers.
the
Yeah.
tranquilizer that's starting to come out. Anyway, I learned that
We
today.
don't recommend using tranquilizers.
Yeah. Anyway, there's more websites on top of that. So I'm wondering if the 72 grand would actually be better for the outreach, the advertising, flyers, Facebook messaging, something geared towards, because this is a youth based, or it's the idea of it that it's youth based or geared towards youth. Here it says youth focused. That maybe that money's going to be better spent, advertising it to schools but you still, when you do advertise it, they still need somewhere to go, which we don't have infrastructure for, or the website or whatever. So anyway, those are my general questions that I have on it. So I will pass along from there.
Well, can Director Manfred address that? Because I think
Yeah.
that was a good question as
Yeah.
far as
Absolutely.
allocation. Yeah.
Absolutely. I think you're right in that there's so much information out there, and that's fantastic. I think what that also does is it makes it really hard for someone in need to sort through and filter through. And I think part of what we're hoping to do is to do that so that it's easy to find, so that it's local, so they're not having to sift through all sorts of places that they might not have access to because they have the wrong insurance, or they live in the wrong place. They live in the wrong place, so don't live here where the resources are the same. And so I think the hope is sort of similar to what you said. We can do this advertising, we can do this work, and we still want to be able to point them to a place to go that's easy to navigate, that's easy to find what they need, and that's really specific to our resources here for them that looks so different. I mean, every county is different. And
Yeah.
I think the one other piece I will share is we have, I think, I can't remember if I mentioned this before, but so the vast majority of public health funding is a lot of different breeding. And we also have a funding stream that is another state funding stream for just really specific to prescription drug and overdose work. We received we're anticipating receiving a smaller dollar amount that is really intended specifically for advertising. So for paid purchasing Facebook ads and purchasing, boosting those posts so that they'll get up to the top.
Sure.
And it's also, I will say that the caveat with that money is it's coming to us as the fiscal agent, but it's part of a three county region, which is Marion and Polk. And so the funding needs to go to support those activities.
What do you
that-
anticipate that funding to be? Because to me, when I'm looking at this, the website should be the smaller piece of this. The advertising should be the bigger piece. Like you mentioned, the swag, the school hour, because this is youth-based. And so anything to get youth interested, get them going in the right direction, because it's not going to be a link on Health and Human Services, like you said.
I know, as much
It-
as I'd love to see that,
Right.
full reality. check.
So again, I'm torn. It seems like the 72K number should be on advertising to get them to the information that they need to see on websites that are already established somehow as a beginner. And then as a secondary, because if this isn't, if we're thinking that this needs to be done quickly, advertising seems to be the quickest to me when you already have established websites to go to. And then secondarily, as we update our websites, that maybe this is integrated with that cost into the new website. I don't know. That's kind of my thought.
So to answer your question, the funding that we're anticipating specific for advertising and boosting and things like that is around $16,000, between $16,000 and $17,000. And again, that needs to be for Marion and Polk County too, so that waters it down a little bit. Although a lot of that will be, a lot of our advertising can cross borders, certainly. So that's how much we're anticipating getting specific to that. And then also the $72,000 for this campaign is partially the website development, but it's also the creation of essentially a toolkit that we can use and that we can have our partners use around the help-seeking behaviors. So the cost encompasses both of those things in it.
And that was the information tracking or gathering. Is that the component of that?
It's more related to specific messaging that is youth-focused around encouraging them to take the next step in identifying, like, hey, this is a problem, and here's it's ways to encourage them to take that next step for them, for their friends, of saying, okay, well, maybe I'm going to go talk to the school counselor or another trusted adult, or just helping them get to that next step when they know there's something wrong.
What's integrated into the website where it's gathering the information, or what are you learning from the website as far as numbers, or how does it track that?
Oh, well, that's a good question. And I don't know the answer to that in
Okay.
terms of like
'Cause
traffic.
You
and
had
things like that.
something on one of those slides that was,
Yeah, we do monitor traffic on our existing website. So what are the most frequently, what pages are people going to, how frequently, things like that. Restaurant inspections is the number one, but we hope to increase traffic in these areas as well. So I can check to make sure that that's built in. I would assume that we'd be able to do the same thing. How many hits has this had on this page and whatnot.
So I think my frustration sounds very similar to yours. But I'll take it a step further in that this doesn't feel like I'm doing anything that's actually going to reach kids. Kids are not going to websites. They're not getting their information from websites. They're not going to hyperlinks. They're not clicking on hyperlinks. They're not looking at PDFs, and they're probably not going to look at flyers either. They're literally buying these fentanyls on Snapchat. I mean, they are so far ahead of us in terms of their access to this stuff. It's scary.
It is terrifying. I've got kids too, right? It's a terrifying thing. Absolutely. And what I would say to that is this is one piece of that much bigger puzzle, a much bigger scope of things that we're doing. This is one piece in a lot of other work that's happening, and even a lot of work that's happening outside of Yamaha County Health and Human Services, right? Through the legislative process, through different things, right? There's a lot happening. This is just one piece of that. And also, I think, we're talking about this platform and a place for people to go, but the other component of the contract is building out that toolkit, which has things that you can put on different, not necessarily even Facebook, but it's ever changing, right? What the new platform and modality is. And so you getting those pieces of information built out so that it can go into those different areas, whether it's Instagram, whether it's, TikTok videos, whether it's whatever it is, that, that's the goal, is to have these materials created so then they can then be pushed out to where youth are. Some of the success that we've had with other programs is also working specifically with some youth, getting youth to say, okay, like, here's this information, how can you push this out? And there are lots of students that want to be part of helping their peers, that want to be part of that. And so that's another way that we can help get messaging out.
And that's the part that bugs me again. That's the expensive part, is getting that information out there to push it out there.
And like I said, we've
And
got
you're
some
getting
funds,
16 grand to split between, 3 different counties.
We also have, so this funding, the 72,000 is not the total amount of the funds that we have until June 30th. So some of the things that we have talked about using additional funds for would be things like the swag nights that we mentioned, as well as we are really hoping to do something related to alcohol. We're working on this first and we got to figure that part out. But there is additional room within that budget. Again, we're being told those funds are not likely to roll over. So we have until June 30th to spend them, but we would have additional funding should the advertising costs exceed what we're thinking in that way.
Yeah, I don't disagree that there needs to be structure behind this. That's not something I disagree about. I guess I'm just kind of shocked that this issue is not just at the forefront of look at what happened in COVID. We dumped hundreds of millions of dollars into COVID because we were fearful that it would, and it did kill many people. This is killing our kids. And I'm just like, I'm shocked that this is not at the forefront of every public health department's number one issue. We are going to reach our children in the schools. We are going to tell them, because a lot of these kids, they're not addicts. They're not using drugs. They're not using alcohol. They have a back injury from a sports event. And they hear that oxycodone is, a painkiller for their backs or to help them with their back pain. And they get it on Snapchat and they die after one pill. That is very different than, I go and smoke pot with my buddies, or I go drink and I want to keep doing that because it feels good and I like being social and I like this, it's very different. It feels like a weapon. And that's what I am concerned about. I had this article sent to me. I don't know if you may have read it, from the Lund Report. The Lund Report reports on Oregon healthcare policy, basically. But it's a 26-page article. I'm not going to read all of it, obviously, but it is shocking. And this was just written 2 days ago. It was published 2 days ago. And this was sent to me by one of the co-founders of the Harmony Academy, Pam Pierce. And Harmony Academy is the only recovery high school in the state. Unfortunately, there's a bill to bring more of them, thank God. But I want to read a couple of these things because I sat there reading this article last night and it was like anger and just rage and sobbing. It was stunning what is happening in our state. It says, when it comes to drug use, Oregon holds an ugly distinction. Its rate of teenagers killed by overdose is growing faster than any other state. And this is a culmination of a story that's been years in the making. And I know that this isn't not new to you. But I feel compelled to share this because I'm just kind of shocked. And it gets to my frustration around something like this. And I hope it explains why I'm frustrated. But it says that we've been having these discussions for 20 years. In 2010, the Alcohol and Drug Policy Commission reported to then Governor Ted Kulongoski and pointed out the severe lack of treatment and a significant gap for teens and young adults. We rank 48th in the nation for adolescent treatment access. It just goes on and on and on. And especially after COVID, the youth addiction services dwindled to almost nothing. There's no statewide system for connecting teens to needed addiction services. School prevention and education efforts in Oregon have remained minimal despite repeated calls to ramp them up. Representative Chris Gorsuch, who is a Democrat from Troutdale, he said there is no current educational work to let kids know about fentanyl, and it's evident. A recent survey of teenagers in Central Oregon found 91% of them knew little or nothing about fentanyl, and 95% knew little or nothing about counterfeit pills and what that actually means. And it goes on to describe the deaths that we've seen. It's a phenomenal article. I will share it with everybody because it's eye-opening. You know, and these are coming, we have a flood of fentanyl laced counterfeit Xanax, Adderall. I mean, some of these pills have been prescribed to our youth for years. And, you know, I remember a lot of these discussions that we've had in the past about particularly drugs prescribed for, you know, ADHD and all of those types of things that we diagnosed with kids with and said, you have this. And now it's coming through in these pills that they otherwise have been told are okay to take from clandestine labs somewhere outside of the United States. Fentanyl overdoses began to surge in 2019. As we know, 3 years have passed before the state offered school districts a way to educate students about the dangers and prevalence of the drug. Even now, neither of the state agencies that put together the fentanyl toolkit, which I didn't even know existed, we have a fentanyl toolkit, Oregon Health Authority and Department of Education are tracking which districts opt in. And there's very few of them that are actually opting in. We have 0 youth detox facilities in our state. And it goes in to describe some of the details as to why. But I'm just really shocked. This says that the chair of the Alcohol and Drug Policy Commission said that the state's strategic plan for addiction is shelved. We have a 5-year plan for addiction, and it's been on the shelf for years. You know, and I guess that my concern, and some of these I marked to talk about with our upcoming discussion on homelessness, because it's very relevant. But essentially what this says is placing additional burdens on already stretched schools and districts to screen and identify youth and refer them to what little youth substance treatment options are in Oregon is likely not realistic at this time, particularly for school districts already challenged to meet the mental health needs of their students. And you just said that, right? You just said, we can't expect school districts to take this on. So in my view, it's on us as the public health authority for the county to take this on and get into schools as aggressively as we can. We know that there's plenty of information. We know that there's toolkits. We know that there are parents who have lost kids who weren't addicts, who are standing up and creating national organizations to try and save our kids. And by the way, Measure 110 and our juvenile department folks will tell you this, Measure 110 made this incredibly worse, this problem. It can't be ignored that Measure 110 has devastated the intersection between our youth and getting them into treatment programs. But that is where I feel frustration with this, because my instinct says we need to get into the schools now and use our authority as a county, use our authority as the public health authority to say, schools, this is necessary. This is not just alcohol use or, you know, or pot use. This is a pill can kill our children. One child, one pill, done. They're gone. It feels like war, to be honest with you. And if you're in a war, you don't spend 6 months going through the plan of how you're going to fight back, right? You dive in, you get it done, and you protect yourself. That's where my frustration comes. I don't disagree that we need the structure behind what we're doing, but I feel like there needs to be a parallel aggressive effort to get in front of our school districts and get in front of our kids. I really don't see any other way. You know, And honestly, they're getting so much information from social media. And if they're buying these Fenta pills on Snapchat, I mean, I don't even know how you break that cycle with social media advertising. They're already leaps and bounds ahead of us. But maybe it is just getting in front of them face to face and saying, look, this isn't normal. This isn't the DARE program from, the 80s when I was growing up. This is very, very different. Fentanyl is not typically something that most people can develop a tolerance to and sort of, it doesn't faze them. It's different than that. So I just feel like the approach needs to be different. And this doesn't feel different. This feels like more of the same. It feels like what's being reported in this article as having failed over the past several years.
Can I speak to that? Is that okay?
Yeah.
So you asked if I read that article, and yes, I read it when it came out for sure, earlier this week. And I do not disagree with the fact that there is an absolute lack of resources throughout the entire state for behavioral health. What I do think, though, is that I am concerned that perhaps I haven't shared enough about what is happening currently. I think the intent of sharing the work that is happening related to all of the information in that PowerPoint was intended to share that there is immediate work happening. The amount of time that I have staff dedicated to this is enormous. The amount of my time is enormous every single day, whether that's working to get detox here locally, whether that is making sure that we have people in those buildings ready for anyone who walks in and needs services, whether that's us having staff out in the community, checking in with the most vulnerable people in our community, and definitely the staff that are in our schools. We have staff in almost all of our schools. 6 school districts have our staff there every single day. So, in that article, it talks about schools having lack of capacity. Absolutely, they do. And we are so lucky to have those partnerships in our schools so that we're right there. So that when there's something that comes up in that school, we're there and we can help support that student, that family, and that teacher all right in real time. We have, so that relationship is so strong and it's different than in other places. And so we're really lucky to have that. In addition to the behavioral health staff we have in schools, we have staff, right now, I have almost 2 full-time staff who, because we can, we're working, this is what they're working on. This is our alcohol and drug prevention staff person and our overdose prevention person, who again is regional. This is all that they've been doing. They are working every single day to do this. And so I want to make sure that the board understands that your level and your sense of urgency is absolutely shared. It's shared by me, it's shared by my staff, and we are working every single day to do every single thing that we can, whether that's the downstream, we're meeting someone in the hospital because they've overdosed and we're going to try to get them in treatment and try to make sure that their friends and family are okay. We're doing that. And we're also doing everything in between, right? We can't just do one thing because it's not going to work. It's not going to work to just do one thing. And so we're working every single day to try to do all of those things, to do absolutely everything that we can. And I also want to make sure that I leave you with information that our schools are amazing partners and we are actively engaging with them consistently. So I don't want to make it sound like there is a lack of communication or urgency on their part. And that's why there's so much stuff happening already, getting people trained, getting information out there, understanding their specific needs in their school and what do you need from us? How can we help? Getting the information out, right? Like that is all happening. We meet regularly with the superintendents. We have a meeting coming up in the 21st, right? Where we can again say, okay, this is what we've done. How has that worked? What else do we need to be doing?
Yeah, I guess the statistic in here though concerns me that 95% knew little or nothing about counterfeit pills and 91% knew nothing about fentanyl. So somehow that, at least with youth, I mean, we have sort of 2 different focus, adult population and youth. I have no doubt that we're doing what we need to do with our adult population. We know those organizations. We know how hard they work too. it's the youth side that I'm concerned about. And when we see 91% don't even know what it is, that concerns me because their parents likely also don't know what it is, right? How do you know how to explain this to your child? So it's that gap that I'm struggling with. And knowing the lethality of this particular drug, along with that knowledge gap, is just, it makes me feel like there needs to be urgency, that 6 months isn't, that's fine if we need the structure behind it, but there also needs to be a parallel effort to just get in front of them now.
And I can assure you that parallel effort is 100% happening.
Chair, can I just weigh in here? I've looked at this, kind of both ways, initially going, okay, this is a waste of $72,000. And then looking at it from the information you gave us today was information that we didn't have before about what else is going on. This isn't just, okay, let's fix this. I look at this two ways. First of all, the state of Oregon has done an abysmal job, not only of drug addiction and treatment overall, but especially regarding youth. We know that when they want to get a message out, by golly, they're going to get a message out, and they don't care how many hundreds of millions of dollars they do for a message that perhaps might even be misguided. But in this particular case, they have been almost like crickets. Why is it just now that the state of Oregon is just trickling out a little bit of information here and there? I also look at the certificate of need that Oregon has, which says if you want to start a treatment facility or rehabilitation or residential care, you have to ask competing hospital if it's okay if they do it. We lost another opportunity to have residential treatment in Wilsonville that would have been 40 minutes away from our county. And I lobbied for that against all odds. But the bottom line is we cannot blame you for what is going on. In other words, we say, look at this terrible problem. Now you have to fix it and you haven't fixed it. I have my frustrations with public health. I've made those clear, but I think that's overall public health we've lost confidence in it nationally. But what I think is now we're saying, this is a terrible problem. You have to fix it. State of Oregon has to fix it. I think sometimes government creates the problems. And I think we're looking with the fentanyl supply, where it's coming from, how it's allowed to proliferate in such quantities, how it's allowed to get such a foothold in our community, and why we're not doing anything to address the supply. That's not your problem. That's not something you can fix. What we can fix a lot of times is where's the parent in this? You're supposed to somehow make this all go away. I don't think it's fair for us to lay that on you. Nevertheless, here we are. And I have one question to that is how much is the total award? That's 72. What else is there?
We're estimating that based on where our projections are showing or what funds will not roll over from the general funding stream for the alcohol and drug prevention plus the one-time funds, that we'll have roughly $200,000.
So that is separate from opioid settlement money.
Correct.
So that's a whole separate.
That's a whole separate, because at this point we haven't prioritized or set that up yet. So we've received funds, but to date, we haven't had the discussion on where those funds are going to be spent.
Is
You
that
know,
200,000 more?
That's $200,000 that is not part of opioid settlement. It's funding that comes directly to public health for alcohol and drug prevention.
But the 72K, is that part of that 200?
Correct.
It is.
It would be out of that 200,000.
So it's sort of like, how do we become the oasis that the state of Oregon has abdicated their role on this? How do we become the more aggressive response to this? If it's not happening at the state level, I mean, highest addiction and lowest access to treatment. It's getting worse. So how do we do that aggressive, full on? And the schools have autonomy, so we can't force them, correct?
Well, there's a bill in Salem that would force them to do it. And that's coming, so.
But how do we, use whatever money we have to get real aggressive? And I do have frustrations with this, again, a website and all that. I understand this is a piece of it. I understand the money would not roll over, which is what makes me inclined to be supportive of this. And we don't have an in-house person who could do this one.
And I do just want to reemphasize, our schools are really wonderful partners and we are working really closely with them.
Yeah, I'm not saying it's our fault or their fault that this hasn't been done, but it's the reality that it has become our responsibility because they're strapped and they can't all do it, especially our smaller school districts. So my thought was having the discussion about the opioid settlement money. The whole purpose of that money is to educate and get into communities about, warning of the risks of addiction and drug use and all of that kind of stuff. That's the whole purpose of the funds. And I believe it was substantial.
Yes, we're going to be receiving payments for quite some time. I mean, we've received our first couple of installments. I don't have the actual numbers in front of me, so I'm not going to guess. I want to say one of them was like 80-some thousand. I mean, they're not, it depends on what your definition of substantial is. You know, I know everyone has a different definition when it comes to that, but I want to say that the first couple installments that we have seen have been like in that $80,000 range. There hasn't been discussions at this point because we're still, the settlements are slowly rolling in as it's, getting through all the various attorneys and everybody who's been involved with that, which is why we haven't expended any of those funds yet. But if the board would like for Lindsay and I to work on a proposal on using those funds that we have received and coming forward, I mean, because we do have expenditure authority to spend those funds. Even though it was unanticipated revenue. So I do believe we have that and we could work on a plan. As far as the use of those funds, that's all subject to various settlement agreements that we also have to look at. I think it's really specific to treatment and prevention. So it's not necessarily isolated to just marketing or campaigns or things like that. It's also for treatment and, other uses that may fall into that category. We just received, it's not that long ago, we received the first payment and we just received word. I think we have another one coming in from another provider. And during the budget process, we're going to be setting up a special revenue fund because these funds are going to continue to come in. And I'm looking at Christian because I know Christian, a lot of times, most of the communications are coming through more of the legal circles than, so there are some limitations that we have to be sensitive to.
No, he's out, man.
It's okay.
Yeah. There are a couple of the lawsuits that have been settled.
Mhm.
We started to receive some funds. There's a handful of additional lawsuits that are working their way through the system. I think the expectation at this point is that hopefully most of those will be settled and then there will be some additional funds starting to flow our way.
Yeah.
How long a period of time those payments are spread out over depends on the individual settlements.
Yeah.
The initial settlements that we've received were going to be 18
Yeah.
years, but even after that was established, they're starting now, some of the defendants are coming forward and saying, we'd like to front load, right? We'd like to make the first 5 years worth of payments more quickly than, so it's kind of evolving as we move through it. I expect there will be more settlements and I expect that will result in some additional funds, but
But we have received something so far.
Yeah.
Okay. And it was, 80,000 or so that you said.
I'd have to go back and
Okay.
look at it. That's why I'm really cautious about, because I don't have the actual numbers in front of me.
Well, I guess my desire would be to look at that pot of money and say, okay, what can we do with this countywide? Bring all of the superintendents to the table and say, we want to partner with you. This is a crisis. This is something that can't wait. Our kids need to know about that, and not just high school, middle school as well. And develop a program that can then be unleashed, as soon as possible. And if money is an issue with the school district, then we use the money that we have. I don't want that to be a barrier. This is too important. So I would love to see something like that come forward in a proposal, separate from this.
I
Yeah,
have some-
I'd be happy to
Yeah.
participate in that.
So I got some follow-ups. So I'm feeling better about this now because now we've gotten to a bigger picture of monies that can be drawn from to now connect the dots to this website that we're trying to build. Number one was, I have one question for you. You mentioned a toolkit. Does that come with like hard copies? Like it-
Hard and digital, well, I.
digital,
think
so
it
you're
likely
printing them
come-
yourself, but like
Yeah.
graphics are done, here's, and geared towards kids and whatever, because that can be fairly expensive all in
It's the-
itself.
Yes, it's the marketing piece, right? We have some staff that are really communication staff and they're great at getting messaging out to the community. They're not graphic designers,
Right.
they're not marketing, and that's what.
So that's
what we're-
part of
that's what we're
this,
paying
right?
for.
Okay.
Yes.
So, and then, so number two, it seems like that's kind of relieving my fears about this is the 72, there's follow-up money for that. So get your base done, get the website done. The ball can't be dropped now because there is follow-up money to go ahead and push the advertising for it. Because if you don't have the advertising, the website's worthless. You can't get the message out. You can't connect the dots. So that made me feel better about it. And then with what Chair Bershauer just brought up with the broader picture, that website will now be there for the outreach to schools and whatever. So I'm feeling better about this.
And also that remaining 128,000 of the
Mhm.
200, would that be, and you have to expend that by June as well?
We do, yes.
So then basically any more aggressive short term, we could put that in the pipeline and use that
Mhm.
pot of money to support this.
Agreed.
The other thing is, worrying about sort of the built-in obsolescence of all of a sudden Narcan, Trank is now perhaps rendering Narcan inefficient and we can't get ahead of this and we just can't get ahead of it. How do we keep up with that?
It's such a great question. And we've been tracking the trank, as you will, or the horse tranquilizer for several months now. We haven't had any known overdoses locally. I would say known because it's possible that there's something we're unaware of. But we're definitely monitoring the situation and it's certainly becoming more urgent and concerning throughout the state. And so our hope is that any of these tools that we develop, particularly the ones with this campaign related to help seeking behaviors, that they could be used and adapted for whatever the substance is, for whatever that is, so that it would be able to be used in the same way when we're talking to youth around trank or other drugs.
And the website could be,
Yes.
This website, the 72K, when we upgrade our county website, I assume we've not just wasted 72K. Somehow those can interact.
They should be able to.
Okay.
We ran all of this through the IT department head as well.
Okay.
Just to make sure that he was comfortable with everything and he was okay.
Yeah, that's been included with that, just kind of keeping in mind that this is like one component or another information with the larger website update, that's
Right.
There's a lot of data and a lot of interface and a lot of information that it's going to be a pretty heavy lift to transition and update all. of
And
our
Coates
data.
is aware of what we're doing far as website development. So there's not some weird little thing like, oh, that'll be another $10,000, please,
Mm.
because we're updating websites to a different cloud provider or whatever.
No.
Okay.
makes sense.
Any additional questions?
Chair,
Okay.
I think in light of the information that we got today, the revision, which is going to expedite this, I would move approval. It's, again, kind of hold your nose and do it because it's a component we don't have. And I would be supportive at this point.
Yeah, I mean, I'm supportive, as long as we have this sort of parallel effort that I talked about with potentially the opioid money and just really injecting with urgency the knowledge to empower our kids directly into their schools in front of them. It's interesting that the principal of the Recovery High School, she said that education is the tool that works. Most of the kids who are using don't rise to the level of needing intensive treatment or admission into a recovery school. but education as to how this affects their bodies, their minds, mental health, all of it goes a long way. So that's encouraging to hear. I also will be drafting letters for the board to consider on the bill that would open up naloxone to pretty much any community member. And then as well, the bill, I think it's House Bill 2767, that will fund more recovery high schools across Oregon. That bill, the turnaround on that one is pretty quick. So I will probably bring that letter of support next week. So with that, any further discussion?
Nope.
Okay, all those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you.
Thank
And
you.
thank you, Director Manfred.
You worked
Thank
for
you.
this.
Yeah.
Really worked for this.
Stop.
Keep me on my toes. And I would be happy at any time to come back and share more specific information about our work in the schools related to behavioral health treatment, alcohol and drug treatment, and some of the prevention and things that we talked about today.
Great, thank
Thank
you.
you very much.
Thank you.
Sure. Okay, we will take a quick 5-minute break and be back 12:16. Okay, we are coming back into session. It is 12:19. And we are picking up at item H2, which is consideration of opening sealed bids for tax lot R 4414 03591 county-owned tax foreclosed real property. This was continued from March 2nd of 2023. And I think we have an update from Jody.
You do. So, and this is an update from my email yesterday. Okay, so we did get a bid from the northern neighbor
Oh.
this morning.
Interesting.
So we now have 5 bids in total. 3 were the original bidders
Mhm.
and then 2 from new bidders.
Okay.
1 being the northern property owner.
Okay.
So would you like me to go for it?
Yes.
Okay, all right. So I'm gonna actually start. This one is from Skyline Real Estate Services. They're the ones out of California. Their original bid was 310. So
Did we verify if that was the bordering property owner?
The northern owner just submitted a bid. That's not them.
Okay,
yeah,
which one are you opening up for? 3591?
no, that is farther down on the agenda. This one, well, this one is
3590?
35,
This one's 3591.
this one is 3591.
Okay.
Yes, but
Okay.
3590 is a little bit farther
Got
down.
it,
on the
okay.
agenda. Yeah. Okay, so Skyline Real Estate out of California, their original bid was 310. Okay, so. It looks like their new bid is $915.
We're sure it's the same one.
But no
Same
payment.
property.
No payment, correct. But they did give us a full amount last time. They only have to submit a deposit of 10%.
Got it.
We still do have that check, I believe. Okay. Try to keep track of these as I open them. Bear with me.
Sorry, that was
910. Or 915, excuse me.
Oh, okay.
Jody, can you restate who the bid's from and the amount so we can make sure we capture it in the record?
Sure. This bid is from Skyline Real Estate Services out of California
And the amount.
and 915.
Thank you.
Just a
Okay.
clarification. Yesterday you said that we needed to keep this open until 4 PM today.
Yes, good call. So the notice that we did send to the northern neighbor gave them until 4 PM today. It was a mistake, should have been yesterday, but the notice did give them until 4 PM today to submit, which is why I was actually going to recommend that the board kick this out another week. But since we got a bid from the owner this morning, I figured we might as well just go forward, but it's up to the board.
That's
And,
fine.
and there's no one else that would, in other words, has been given that deadline.
No, nope. We only gave that to the northern neighbor. Yeah. Okay. So this one is from Anthony Cholera. I don't know if I'm saying that right. It's out of Salem. His original bid was $112. Good. You good? So much pressure. Okay.
Letter opener.
No kidding. Okay, this one is for $1,468.
Am I missing something on how they get to those numbers? They just pick them. Okay.
Yeah, I believe the real market value is 306.
So they're gonna go do
Yeah.
1,468.
But, you know. Okay, so this one's gonna be from Jacob. Jacob's the one who was on Zoom last time.
Huh.
His last bid was $220. Jacob stuck. His new bid is for 515. Okay, so those are the three that had already submitted bids. Here are the two new ones, and I'm not sure who's who because they don't have names on it. One is the owner, and then one is Jessica Johnson, who
Is the daughter of
is the daughter of the estate that I believe sold it to the new owner. Does that make sense?
Yeah.
This is all secondhand, so
Okay.
this is information from them. So that's not a legal analysis or finding.
Oh.
Jessica's here? Oh, okay.
I wondered, I thought I
hello.
know somebody by that name. That can't be.
Okay, so Jessica submitted a bid for $300. Okay, and the last bid is from the one we got today. His name is Mark Frey. Mark's here too? Okay. Oh, okay. Okay. Mark submitted a bid for $5,175.
5,175.
That sound right? Okay, yes, that's what he said.
Okay, and is it appropriate to clarify if,
Absolutely, yeah,
Mark
you can bring
is-
on. You
Mark-
can bring Mark up. if you'd
Mark,
like.
can you come up just for a quick question? Thank you. Does anybody have the map?
Yeah.
Okay, if you could just state your name and address for our record, that would be great.
Name is Mark Perry, 3850 Northeast Arnold Lane, which is the address of the northern foundation.
They want the tax law.
No, this is fine.
Split it
This
back.
is it. Right.
Mhm.
Okay. So we had a lengthy discussion was it last week? About how this is just a little chunk of land, at the bottom there along a river and feasibility of access and all that kind of stuff. So are you a part of this northern estate? In the sense that
I am the owner.
you are the owner of the estate? Okay. That's just what I wanted to
It's not
clarify.
necessarily
And
state.
I did find a
Okay.
deed for this property to you. I
Okay.
just wasn't able to trace. It looked like it came from Mary Lee Johnson to you, and I wasn't able to trace. I didn't have enough time. The deed from who the tax assessor has, which is the estate of Dwight Johnson.
Okay. Yes,
Okay.
that's what it says here.
Yes,
That's the next stop is how to fix the addressing.
Yeah.
And on that letter.
so I
Okay.
just wasn't able to trace from that estate to Mary Lee, but I have a deed here. I'm gonna take his word for it, so.
Okay, thank you. Appreciate it.
Thank you.
Okay, so we are,
So you can decide which bid you want to accept, if any. You can reject them all. You can accept one. If you don't accept the highest, you have to provide some sort of justification for that.
well, I think Mark made it easier for us to accept the highest bid.
I agree.
And it just, for me, it makes sense based on the proximity of the land to his property. So I move that we accept Mark's bid of $5,175. Any further discussion?
Nope.
No? Okay, all those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes.
Thanks,
Thank you,
Jody.
Mark.
Thank you, Mark.
Thank you.
Thank you, Jessica, for coming.
Jessica.
Okay, let's see. Back on the right. Okay. So this brings us to item H3, which is discussion of City of McMinnville's request for a county emergency declaration related to McMinnville homelessness. This was continued from last week, March 2nd of 2023. And we do have public comment in the audience for this item. And it looks like I have Mayor Remy Drabkin first. So Remy, if you'd like to come up. And this flyer is not for you, specific to you, right? Okay,
I'm not.
It's
sure
for
that
sure now.
flyer
Okay.
is- I do have.
a flyer. We're on the topic. so. Okay,
All
we're
right.
ready for you.
Thank you, honorable commissioners. I do want to thank you again for the careful consideration that you've given this matter. I understand that you do not take this decision lightly, and I also bear tremendous weight on the decisions that come before me, as I'm sure the other two mayors in the room do as well. I see the time and the thoughtfulness that you've put into your decision. And I greatly respect and appreciate the dialogue that we've had in this room and that you've had in many rooms. Thank you for that. I've thought a lot about the conversation surrounding exhausting all possible resources. And as I previously stated, at the City of McMinnville, we have exhausted resources that weren't even meant to be spent on these problems. And today, we find ourselves at a crossroads on one important project in which we did choose to invest. We do not have the monetary funds to complete the navigation center. As mayor, I have gone to the governor for the additional dollars. I have gone to our House legislature and met with many members asking for financial resources. I have visited with our state and federal senators asking for assistance for this and other financial burdens that we at the City of McMinnville cannot bear. I've met with members of Congress asking for help for McMinnville. And for this, I really owe your board an apology because I should have come to you first. And at the City of McMinnville, we have partnered with YCAP. We partnered with former Representative Noble to bring a navigation center to town that we believe will make a critical impact in our ability to interface with people as they are homeless and to get them into services and off the streets and into the right programs. The monies we were allotted by the former House no longer cover the construction costs. We are short just shy of $1 million. The construction market changed. The project will cost more to construct than it would have when the legislation passed. And as you understand, we cannot contract for the construction if we do not have the funds committed to pay for it. If you don't pass this state of emergency, which would allow us to pivot and redirect funds, would you consider putting the remaining $1 million into the navigation center? The navigation center will have reverberations into the county, but it is a very McMinnville-centric investment. And we know that our issues are countywide. I would like to see us take a regional approach. There's more that can be done with access to those state funds and access to that technical assistance. This is an opportunity for us to partner and to come together as a region. I've also dug in a little more on the questions related to how the dollars can be used. And we learned from OHCS yesterday that the executive order dollars can be used to create additional shelter beds, but not housing. So we could use those funds for YCAP's Any Door Place Navigation Center, and maybe for Gospel Rescue Mission's transitional shelter. But regardless of dedicating funds to capital construction or to operations, we can make the resources from the state go far. This is an opportunity to tell the state what we need so that the solutions are designed to the challenges. This is not the state usurping our control. This is our opportunity to say what we need. Since we've started these conversations, a new report has come out. That's the paperwork I handed you. This is just on cities with populations over 10,000. So not all of our Yamhill County cities were even included in this. Again, we don't have full data, but the state has now identified McMinnville as a severely rent-burdened city. This means that over 25% of our households are dedicating over 50% of their income to housing. It means more people are on the brink of homelessness or one paycheck away. It also creates another administrative burden for the city of McMinnville without creating additional resources for us. We have an opportunity to access state funds and technical assistance in a way that it has not been available to us before. We need these resources, and you are the gatekeepers to these resources. We have a shared morality. We all want to make this situation better. We want to address drug addiction and mental health and homelessness and crime. We want clean streets and parks. We want to be safe. We may not always have shared methodologies, but we want the same outcome. We want this situation improved. Access to the emergency declaration allows local area experts to advise on the most impactful investments, and it's method neutral. Entry into the executive order also gives us access to state funds to then accomplish those projects. I like to say, if you want to go fast, this is not me saying this, I like to repeat the sentiment. If you want to go fast, go alone. If you want to go far, go together. Thank you very much for your service.
Thank you, Mayor.
Thank you.
you.
Mayor, I have a couple of questions. So regarding the navigation center, I had my third meeting with Director Bell. I know you got the message too late. That was a real quick turnaround. So it would have been good to everyone to be there. But nevertheless, I want to share some of that. So I had asked the question specifically regarding the navigation center and the funding. And I asked her, I believe on our second meeting, if we could use that funding for the navigation center. And she said, unless there were beds 24/7, that would be a no.
Yes, and I do believe in the overall design, and maybe our special projects manager who's more familiar with the design documents, but I do think that there is an emergency bed at Any Door Place. It has shelter beds as well for overnight use. So I do believe it meets that criteria of being increasing our overall number of shelter beds.
For Newburgh, or are you talking about McMinnville for?
I'm talking about McMinnville, although obviously the Newburgh Center as well, because I believe that I'm less familiar with the Newburgh project, but I do believe the Newburgh Navigation Center is an extension of the project that's already in place, which is approximately a 20-bed shelter. Right.
Okay, so to be clear, is the navigation center in McMinnville, does that include plans currently? And has it always had plans to have shelter beds?
Yes.
Yes. 36, okay.
But what
Um,
I'm hearing you say is that it has to be staffed 24 hours a day.
Yes. And, okay, the capital construction piece was one of the discussion items that we had with the director regarding capital construction.
Yes, and I did you may recall I said last time I didn't want to do anything you didn't ask me to do. And I did hear you say it would help if you could help get us this answer to these questions. So I did copy your questions from your emails and then send emails as well to Director Bell, Jessica Pratt, and the state's emergency manager, Director Garrett, and said, I understand that our county commissioners would like these questions answered, that they could be pivotal to their decision-making. And then I missed that call. I didn't see the email invitation for that call. I was hoping that you also were able to get those questions answered. And then I asked that capital construction cost when I got a call back the next day too.
And the answer was?
The answer I got was if it was used for shelter beds, it's allowable, but not for housing. So for instance, I wouldn't necessarily say, I feel confident that we could use this for Operation Generations
Mhm.
project because that's really that's a housing project. And it's why I think perhaps we could use it for Gospel Rescue Missions project, but I would need to see the exact guidelines. It would need to be tested up against that.
Right, and I have some information because I reached out to Kay Sawyer, but just in terms of the questions, because I know Chair Bershauer submitted a list of questions. I submitted a list of questions, and that was two weeks ago.
Yeah, I mean, I'm hoping that you have some answers from them because in all honesty, I submitted over 15 questions and I have not received a single piece of correspondence in response.
No, I haven't either.
It's
yeah.
almost like they don't want to put anything in writing, which is suspect in my opinion.
Well,
If they
I
really
know
wanted
that,
participation, they would have answered these questions.
yeah, I know and I'm sorry, I can't call them out directly. When I read through your questions, I found some of the answers that was more of the technical answers in the guidelines for the emergency declaration. I'm not remembering the specific questions right now, unfortunately. And then I also underlined that request, and I believe I did everything that I understand that. I said
Yeah.
the same thing. I said
Yeah.
it would be so helpful to have answers in writing so that we're not having a conversation that's related to how we interpret our conversations, but that we have the same words in front of us to interpret. That being said, I don't because of the flexibility with the funding, because of our ability to be flexible, I don't see that as whether or not those dollars can be committed to capital construction for shelter beds only. We have so many projects that are ready to go, and we have monies that are committed from different pots. So if we need to go back and say, we need to move these dollars over to capital construction to allow for these dollars to be used for operations, we will do that. We will do that work. And again, the city of McMinnville is not only willing, but set up to carry a lot of the weight of the responsibility of this. We brought on a special projects manager specifically to manage our ARPA dollars and the investment that we got from the state last year for the navigation center. So we're already engaged in that work. We have reporting tools in line with it. So we feel prepared if you're concerned on capacity issues, that we have the capacity to do it, that putting our energy into that management in the long run will be less of a burden on the city of McMinnville as a whole.
And I think I'll be sharing some of my conversation with Director Bell the last meeting, but again, it's been a total of 3 meetings, 2 with Director Garrett and 2 with Stan Thomas. And our emergency manager is here, who can also fill in some of the blanks that I might. But again, not having those definitive, the empirical, you hear the answers instead of because they were not put into writing. And I have to say, I wrote down some quotes, and I don't know that I've ever experienced a more, I'm going to use the word convoluted, because I said to Director Bill, well, I'll go into that later, because I want to just give you the full package of that conversation. But we have more people who want to talk, so
Okay.
I don't want to jump in now.
Okay.
But thank you. For
Thank
that.
Thank you. Thank you
Maya.
for your time and consideration.
Thank you.
Okay, so next is Heidi Bell, Marion Thompson.
Good afternoon.
Hello.
Welcome. Welcome. So we're here again to express our continued support for Yamhill County's emergency declaration to address poverty issues. We believe that unlocking these state funds could help us in our effort to connect our most vulnerable citizens with essential services and resources such as sanitation, nutrition, warmth, safety, and some temporary shelter. We know that domestic violence is a significant cause of homelessness in our area, yet we have no local services. We'd like to thank Commissioner Kit Johnston for attending recent Sheridan Council meetings. We appreciate his taking the time to hear firsthand about some of the issues facing the Sheridan City Council. Affordable housing, homelessness, and providing primary resources are topics at every council meeting. We've also seen Mary and Lindsay at various events and meetings in Sheridan, and we appreciate that. We've come up with some reasonable solutions for some of our problems and hope to discuss them with you soon. Of course, you all have standing invitations to come out and visit and see what we're up to in the West Valley. As you know, poverty and homelessness aren't just an issue in larger cities. Sheridan leaders are committed to bringing the essential resources to our area. We love our West Valley neighbors and hope to continue working together to tackle these issues. We believe establishing a one-stop resource center, possibly a Yamhill County Social Services Satellite Office, much like the Polk County Resource Center in Dallas, if you've seen that, would greatly enhance the delivery of many essential services for Sheridan and Willamina. We know that many low-income families and individuals from these cities rely on Yamhill County services in McMinnville, which can be difficult for many West Valley people to navigate. It's not that easy for a lot of people to get to McMinnville and then navigate from place to place. So we hope that you will consider financial assistance for this project to benefit the West Valley and to maybe expound more on our idea about the resource center. Heidi.
Hello, commissioners. Thank you for having us today. In front of you, I hope it made it over to you, is a little one-pager sheet, and I'm just going to read directly from this. We are writing to propose that Yamhill County consider negotiating with the city of Sheridan to purchase their existing city hall building and transform it into the Yamhill County Social Services Office. This acquisition of this building would provide a central location for the provision of critical services to the residents of Sheridan and our surrounding areas, including Willamina and the rural areas. By transforming the existing City Hall building into a social services office, Yamhill County could enhance its efforts to promote the public's physical, emotional, and social well-being through services, prevention, education, and partnerships. The building could be used to provide a variety of publicly funded services, including behavioral health, developmental disabilities, and public health services. It is worth noting that the existing City Hall building has a drive-through that could be repurposed to provide convenient access to food for the community. This could be especially beneficial for vulnerable populations such as the homeless, elderly, or low-income families who may face challenges accessing food due to transportation or financial barriers. Additionally, the building's storage capacity could be used to store food and supplies for a co-located food bank tenant, further supporting efforts to address poverty and food insecurity in the area. Overall, the building's existing drive-through and storage capabilities present an opportunity to provide essential services to the community while also promoting convenience and accessibility. In addition, the location of the City Hall is the center of Sheridan, and would make it easily accessible to the community members, once again, including Sheridan, Willamina, and our rural West Valley community members, including reducing barriers to accessing services. It would also provide a centralized location for staff to work together, collaborate, and communicate effectively with each other and the community. Furthermore, the acquisition of this building would align with Yamhill County's values of equity and diversity, community focus, collaboration, and continuous improvement. By providing essential services to all residents of Sheridan, regardless of their backgrounds or circumstances, the county would be promoting opportunities for all people to reach their full potential. In conclusion, we urge Yamhill County to consider negotiating with the city of Sheridan to purchase its existing city hall building and transform it into a Yamhill County Social Services Satellite Office. This would be a great opportunity to enhance community services, promote a collaborative environment, and align with Yamhill County's values. Thank you for your consideration.
Thank you.
Thank you. This is,
Can I ask the obvious question? Where are you going to move to?
That is in executive session with the city, but the city hall.
You do have a,
City Hall is
proposed
going
home.
on the market in very soon, and so is our library and other facilities.
it's an older building, isn't it?
It was built in like the 70s. or the
Yeah.
80s. It looks old. It looks older.
it's actually
looking
pretty, it's a
again.
very cool building.
It's very-
wonderful building.
Yeah,
Mhm.
yeah.
It's very cute.
It's a great building.
It has lots of offices available in it for you. We are very fixated on the idea that it could be offices with different nonprofits that are already in existence. And so being able to provide those services, and once you start to bring people together to share a copy machine or share, electricity, that you can make a bigger difference. Ken?
He needs to step out for negotiations.
A lot of old buildings. and
No,
old
I
homes.
was
Share-
just gonna add, we're in receipt of the proposal. I think we would also need to have possibly further discussions in executive session on how to proceed as well.
Absolutely.
And if
Thank
I do remember correctly, I don't remember if we lease or, because I know our community corrections has a small
Mhm.
office there in our
We
sheriff's
provide it
office.
for you.
Okay. Yeah, and our sheriff's office also operates out of there as well. So.
Yep, and they'll be relocated with City Hall.
So it's already in the works. It's gonna go up for sale and. all
Yeah,
that.
it's
Okay.
either we work with you for this process, or it goes out to the private sector.
So we should really have discussions, in-depth discussions, and I don't know that this is the place for it, but
Mhm.
I appreciate you letting us know because we've got there would be many steps.
Much like the city, most of our property transaction discussions, we usually start in an executive session and have
Yeah.
those.
So we would have to do it that way, but this is good to know and thank you for bringing us.
Yeah,
Yeah.
we like to be solution-oriented people. And so, and we like to also be very focused on doing the best for our community. And one of the things that we consistently hear about is, just the burden to get into MAC. So,
We do that. We hear that as well.
Yeah.
But thank you for that. We appreciate you
Yes.
coming back.
and
Thank
then,
you.
yeah, if you don't mind, I have one other small thing. Well, it's not that small, but just a little quip, is that the school district would also, and the city would like to support the continuation of the rehabilitation apartments that you have located and the programs that you have in Sheridan. So just to make you know that those are important. We would also continuously hear that people would like to have, they're supportive of the houses being for rehab, but that we'd also like to have homes or apartments that are for people like to get, off the streets as well, that don't necessarily have rehabilitation or needs. So that's just a small piece, but the school district is really into making sure that those apartments get built and wanted me to share that with you.
Thank you.
Do you have any other questions for us?
No, thank you.
Commissioners?
No, thank you.
Okay.
Thank you.
Thank you very much.
Thank you. Okay, is there any further testimony on this topic or agenda item? And if you are online, please raise your virtual hand. Okay, seeing none. We will kind of dive into discussion. I think since Commissioner Starrett did have conversations directly with Director Bell, that's probably where we should start. As I said, I didn't have any of my questions answered, so I really have nothing to offer there, but I did speak with other commissioners in the rural continuum of care. So I have some updates there, but I believe your update is probably the most substantive, so.
Thank you, Chair. This is going to be a little bit involved, but I did want to share, and especially since we have a new commissioner. And we also, I think the greater community is not aware of the breadth of services that the county is either partnering or directly supporting. So I wanted to share that. And having been the liaison to Health and Human Services, the Housing Authority and YCAP, I thought it would be good to put it all together so that everybody had an idea of what our portfolio is, what we do, where the gaps are, and what we still need to address. And I think we've demonstrated a real significant commitment to homelessness and supporting housing options. One of the things I decided early on after I spoke to Director Bell was to find out how other communities sort of stack up against ours compared to ours. And according to discussions with her, a lot of the rural counties don't have anything even close to what we have in terms of collaboration or also sort of that infrastructure that's going on. But just to give you an idea, Health and Human Services has 127 beds of housing. When Sheridan is complete, there's going to be 163. HHS does a lot of work to support people with housing vouchers to find a place to live and then to remove those barriers. They have a peer-assisted crisis pack house, 5 beds, up to 2 weeks psychiatric stay, 8 units at Bridges, which is another complex, 7-unit crisis respite. They have another 18-month option for individuals with severe and persistent mental health issues, which is a lot of what our homeless population is struggling with. Yamhill County Deer Creek has 2 beds, 2 bedrooms, 2 adults, up to 30 days, and child welfare is involved with that. Yamhill County Bakerfield Transitional, I remember going over when this project was built, and the setup that the county has had typically is to contract with a private developer to actually do the build, and then we do a 5-year master lease so that we don't incur the financial liability, but we have secured those spaces. These are apartments that are ADA accessible, and we're going to provide support and wraparound services, and they're beautiful they could be market rate apartments. And so we've got that up and going. There's 7 beds there. Yamhill County TTRS homes, you've heard us talk about the transitional treatment and recovery homes. We have 6, and I won't list them all, but we have 6 homes, and that includes basically 5 bedrooms in each one. And we're talking about parents and children, men and women. Yamhill County Aspen Ridge, there are 15 units, and that's long-term to permanent housing. We have Sunnyside, which is 15 units. Yamhill County Homeport, 14 units. Forensic and rental assistance programs, 20 slots for that. Reed House, we have 3 beds. Deskin Commons, 8 units. Yamhill County Sheridan Apartment Complex, there are 30 units in phase 1 and 36, as you know, in phase 2. Total of 66. Some of the other programs we have include, turnkey. We've got 55 rooms there. 40 are used with a total of 60 beds. Current wait list of 130. So we do have some need there. YCAP, the Newburgh Motel Shelter, 10 beds, 3 months to a year, men, women, and children. Met with the mayor and with YCAP Director Alexandra Hengen on concerns regarding the Newburgh shelter, and also with one of the city council members there last week. And we talked about some of those challenges. The YCAP Youth Outreach Center, which will provide and does provide in Newburgh countywide 3 beds. And again, I met with the Oregon Department of Human Services Child Welfare Director last week, and we talked about the challenges of youth homelessness. 50% of those who are on the street now came out of the foster care system. So how do we address that? We've got 80 kids in foster care on a regular basis in Yamhill County. How do we make sure they either don't stay in care, or that if they age out, that there are some supports? So how do we address that? Well, we support YCAP Youth Outreach has a number of programs, ages 11 to 17. They have a transitional living program. That's 11 beds for 18 to 24-year-olds. Henderson House, we talked about domestic violence, 5 bedrooms with a maximum of 13 beds. Greenleaf, Oxford, Morgan Lane, Oxford, talk about addiction being part of the homeless community, component. Oxford long-term, men and women. Serenity House, 7 rooms long-term. McMinnville Hope House, 7 beds. Amity Hope House, 5 beds. Newburgh Helping Hands, 3 houses with 26 beds. McMinnville Helping Hands, 14 beds for 22 people. Love Inc., 5 Rock Ranch, that's longer term housing, 1 to 3 years. Blanchet Farm, 12 beds, 9 months. It's a phenomenally successful program for men in recovery. And there's nothing that can argue with success, and they are successful. YCAP, the moteling project, again, youth outreach. Legislatively, I do want to remind everybody that we have been trying to address this legislatively. One of the things we see here, and we've seen this over the years, is when the county winds up with a tax foreclosed property, we're sometimes in the position of having to say, you have to leave. Now, I don't know of another county that has been more lenient with that and dragged it out longer so that we never have to evict somebody to the point that they have nowhere to go. So I asked Representative Noble, can we do something to basically give the equity back? Once a property is foreclosed on, all bets are off. You lose everything in that house. And the county is required by the state. We tried to do a workaround and we couldn't do it. We're required by the state to take that property, to sell it to the highest bidder or use it for the best community benefit use. And then to take all that money and disperse it to 43 taxing districts, which means the person who's lost their home, usually they're elderly, disabled, medically fragile, they are homeless. They walk out of there without a dime to their name. And that is unconstitutional. So I asked if Representative Noble would sponsor this bill, and no one at the state legislature was interested. So when we talk about trying to stem the tide of homelessness, this was one way we could do it. But I think greed took over. And if there was a pot of money to be had, there were all eyes on that. And we were not successful in that. But what we did do was work with our assessor's office and say, hey, do you have people on your radar who are in danger of losing their property because of tax foreclosure? And he said, yes, we're going to work with the housing authority that has a tax foreclosure problem, a mortgage and tax foreclosure abatement program and avoidance, and get this information out to them so that we can work with them to save their homes. So that's something that is actively being done that wasn't done before. And the other thing is we used our ARPA grant of $500,000 for Stratus Village. We all know that that is much needed housing, but it's a drop in the bucket. We have taken our homes, oftentimes properties that can be rehabbed, and we have transferred them to Affordable Housing Corporation for sale for affordable housing or for rehab for a variety of other issues. The Yamhill Gospel Rescue Mission, we have given them 4 grants, 3 for expansion and the most recent for shelter operations. Lutheran Community Services, the relief nursery support and safe family support, which is vital. Also take a look at what Yamhill Community Justice does. These are adults in custody who are released from prison on early release. We have approximately 20 subsidy beds per month for a total of 240 beds per year. So basically we're taking people who would be homeless because there's nowhere to go when you're incarcerated and you get out. Nobody wants to rent you an apartment and you don't have the means to do it. So I use this by way of letting you know that this is something the county has demonstrated commitment to over the years. Now I'll go to my conversations with Director Bell. We've been frustrated with trying to have these questions answered. And you, Mayor, know that when you submit these questions and there was a promise we're going to get them to you and then they don't come, it's a little bit frustrating because we don't have anything in front of us that we can say, hey, this is the truth. We're hearing so many different stories. So I will say that Director Garrett was probably the easiest to communicate with in terms of just getting a short answer. We got a lot of answers that were quite circuitous and never really got to the meat of it. And that was frustrating. So the question regarding Clatsop County, and I think Chair Bershauer, you had a question about Clatsop County submitting their their emergency declaration 3 separate times and had to have revisions. Well, Director Garrett pointed out that their emergency declaration was not aligned with their emergency operation plan. So that's why they had to have some fixes. He said, based on the one that they have seen, ours is. So that was an easy answer. Couple of questions. I asked Director Bell, yes, our last meeting, she said, well, we're seeing a lot of each other. I said, no, Director, the problem is we're not seeing enough of each other. We need more answers, more direct answers, more short answers, more yes and no answers. And I'm going to tell you they were not forthcoming. But I will tell you what I gleaned out of this conversation, which is the last one that we had. The bulk of the HUD grants over the last 2 years went to the metro counties. So the balance of those funds with a much larger territory, 26 counties in the balance of state, they got around 10% of that funding, and they had a whole lot more area to cover. So I asked, why was the continuum for rural Oregon left out of the executive order? Because the League of Oregon Cities early on asked the cities, all the cities be included. And the governor said no. So we're asking the question why. And I asked Director Bell, why is that? And she said, well, we were basically predicating this on point in time. And I said, well, if we do submit, are we allowed to use information that we have, which is analogous to that? And she said, yes. So I said, well, which is it? Why couldn't we use that information? Why couldn't that information be considered when the whole declaration was rolled out? If you have the information and we can provide it and prove up and show the receipts, why weren't we included? So I haven't gotten a whole lot of really good information other than I said, if we were to focus on the 27.4, which is in House Bill 5901, would we have more latitude? She said yes, and she used the term, if you galvanize to support House Bill 5019, you will basically have more latitude for the funding and 2 years to do it because it's a biennial budget in that bill. The executive order requires us to expend these to do this by January of 2024. We would have more time for preparation. The benefit to this pathway is that the state will still support us with technical assistance. I expressed concern about autonomy, and Director Garrett also pointed out that that MAC group that we would have to stand up. I said, do we have flexibility, and who has a seat at the table? And I appreciated this. They said, you know, we don't. I said, do we have a commissioner there? Do we have local public health authority? They said, we don't want this to become political, and I think that's a great idea to some degree. We do want people to have a seat at the table who are working with the various county and partners. But they said they want the service providers there. And I think that Director Bell's background as a service provider in housing made that very clear. You want the people who are doing the work, who are interfacing with folks who can benefit from this. So that's a whole separate piece. But again, I had conversations with regarding the mission. I had conversations with the state, ODHS, and I came away with more questions, and I don't know that there's ever been a more convoluted process why we couldn't just go and basically say, if there's money available, can we apply for a grant? Here are the numbers. Now let's go ahead and do what we need to do in our county. So I'm going to stop there and not go on anymore because I know you've got to fill us in on what you heard from the other counties.
So is it 5019 that is the 27.4 million? 5019. Okay. You mentioned 5901. Is that
I'm sorry,
something that I'm not?
I misspoke. It is 5019, sorry.
5019. Okay.
5019 is the 27.4.
Okay.
So, yeah.
For the non-emergency counties.
For the rural continuum of care counties, which is the 26 counties, not NEO. So my follow-up with commissioners, and again, I've been reaching out directly to the two, there's only two that have submitted some type of EO or emergency declaration. And that is Clatsop and I believe Benton County. Clatsop, we talked about a little bit. They had 3 different versions. There was some issue with their, emergency plan. But they were still very concerned about the language in the emergency declaration that says, the mayor mentioned it earlier about we have exhausted all funds. So they spent considerable time on that with their legal team saying, how do we write in here that, we've done that, but in such a way that doesn't get us in trouble. So they were still very concerned about that. Benton County is continuing to have conversations through the end of this month. So I'm not quite sure what they submitted. I think they started with a letter. But other than that, there is no other county that I know of that has done this. I was in front of many of them last Friday for the ONC meetings, and some of them didn't even know about this, right? So there's no communication or education being done on that. The other ones were aware through sort of side conversations that they'd had that the intention of this money, the $130 million, is in fact to go to these emergency order counties, the 10 counties. And when I talked to some of the commissioners around that table were in the EO, they are Polk County and others, and they mentioned that they have already been told how much money they can expect to have, which is part of why there was deadlines around getting their plans in and making sure that we can get the checks cut, money out the door so it can be spent by January, whatever it is. So it sure seems like there was a plan to get this rolling very quickly, which you have to do if there's that kind of deadline. And that's what was communicated to those counties. We've asked the question multiple times, what is the process? If, for Clatsop or Benton County, they've submitted something, what's the process? How will they be processed, prioritized? What kind of money is available for them? What does that look like? And we can't get an answer on that. It's almost like, follow us on this rainbow, but there's no pot of gold at the end of the rainbow. So what are we doing? And they still can't answer that question. What they do seem to pivot back to is this 27.4 million. I don't know what the genesis of that was. My assumption is that there was significant pushback with the governor that she did not include 26 counties. And so there's something for us, right? If you do the math, that's about $1 million a piece if we all apply. After my conversations with rural commissioners, my impression is that some of them aren't going to bother applying, so maybe there will be more money. Sorry. But it's really frustrating to not know for sure if this entire process is even worth the time and effort. We've already put 3 weeks into this. If there's going to be any of that $130 million left, I still don't know. I still don't have an answer for that. So
the question was, regarding reporting, because I asked Director Bell, if we, as she says, galvanize and focus on the 27.4, what would the reporting be like? And they didn't have an answer because they don't know. The only thing that they think is that perhaps they'll start to use a template that's close to the HUD reporting. So you have to do a certain type of reporting for HUD. And that is what they're going to be doing with the executive order states, counties. And they think they might do that because one of the other things is we have to think about is how will this reporting be done? When they don't know, we don't have an answer.
right. So I did follow up with those commissioners, the rural continuum commissioners, and said, okay, what are you guys doing? Please tell me what you're doing, share it with me so I can understand how to potentially move forward. And most of them are not doing anything, just to be honest. There are certain ones, Coos County Commissioner Sweet is drafting a letter for his board this week and will be submitted by tomorrow to the governor to again press her to include rural counties in a larger pool of money. I don't know if it's the 130 million, but it's something more significant because $1 million is $1 million. And sure, as we heard from the mayor, we can use it, right? We already have a plan for that. but it's kind of a drop in the bucket compared to need. So I'm not sure exactly what that will look like. I did commit to him that I would work with him to draft a letter from all of us. I think it's more impactful if every rural county signs on to a letter to say, look, this is a problem. You're putting us in a corner. There's no answers. And we either need answers or we need a different solution. And so if it's the $27.4 million, that bill, okay, but that's not very significant in terms of funding. I think we do commit to us not only supporting the bill for 27.4 million, I think we have our plan ready to go. And if it's a single plan where we're asking for funds to finish the navigation center in McMinnville, that's what it is, and that's what we will support. You know, I have had conversations with commissioners on a more of a philosophical level of what do you believe is the county's role in all of this? Because it feels like there's such a difference between these needs focused in the cities, in our cities. And when it comes to housing and all of that stuff, we don't really have a direct role. We are a partner, but we don't go in and build housing in cities, right? So that was a very interesting perspective in terms of how certain commissioners view their role. One of them said, you know, I don't build housing. What I do is I go in and I partner. I will help fundraise for it. I will help make sure it happens. But my role as a county commissioner is to bring in the services. We provide the services, the wraparound services to make it successful. So lots of great discussion. And I really appreciate this, Commissioner. This is incredible to have all of this put together to provide a perspective on how much we actually do in this context. It's really impressive, frankly. Again, I don't know that I have the answers to the questions that I need at this point to move forward with an executive or an emergency declaration. It's something that we are proactively committing ourselves to. And in order to get there, there needs to be basic answers to these questions, and we just don't have them. And I don't know how to jump over that gap. It's too wide at this point.
The other thing is, you know, the whole concept of declaring an emergency, as I've said before, I think it's been misused and overused. And I think what we could have been so much more, you know, I know that the state loves to use the word equitable, could have been more equitable to say, we've got this issue in our county. You've designated this much money to the metro counties. We're struggling too. You might not see our people on the street under a bridge, but by golly, they're in the woods and they're living by rivers in Sheridan. And that's real. And we have a problem too. And just because perhaps we're not considered a blue county, Governor, we still have concerns, and you govern this entire state. Why did it have to be an executive, an emergency declaration? I think we have seen legitimate reasons for emergency declarations. We saw them with the wildfires, we see them with water, we see them with drought. But I don't know why this had to be a component of trying to get money that we all desperately need. And that is concerning because there's no answer other than, well, we think it will give you the sort of the emergency operations way of doing things if you have this infrastructure. I think we have the infrastructure in this county, and people are I mean, we just heard they're all doing the work. So to me, this was sort of an odd way to disperse funds.
It does feel very odd and clunky, and I'm not sure. And what I go back to is I'm not sure why it was even offered as an option, because if there's no money, there's no money. What are we doing if we're not working towards a goal of having a piece of the pie? It just doesn't make any sense.
Well, she said there was, when I asked her the first time, does that mean pretty much the money's been expended? The 130 million has been expended? And why are we going through this exercise if there's nothing left for us? And then she, on this last meeting, I said, is there anything left for us? And she said, yes. And then the buts really do stack up in terms of the restrictions and the time. When she said, if you want to focus on the 27.4, you have 2 years to do it. You have more leeway. on how to spend it.
But, so she said yes, but then she didn't say how much,
Like
even
how
though,
much. It-
even though they've already emailed all of these counties, 10 counties to say, here's what's coming to you. I mean, I don't know. Is this like not simple math? What am I missing here? If it's a certain finite piece of pie of money and you're divvying it up between 10 counties, don't you know how much money's left?
Yeah, but you're divvying up something that hasn't even been approved yet.
Right.
So there's a lot of questions to be answered here. And I mean, I have just one question that probably would lead to 20 others. And it's, can you at least write a letter of appeal to stop the clock? You know, because tomorrow is technically the or the 10th is technically the deadline. But, you know, last week that turned into a rolling deadline. So
You're
there's-
right,
there's
because some commissioners are
contradictory-
talking about taking this up at the end of the month
Right.
and,
Yeah.
and considering it. And I'm
So in the
thinking, well,
meantime,
we're
do you
hearing
do a
deadlines.
letter of appeal? Just
Well, I think
have
there needs
something
to
in the
be,
works,
there needs
or-
to be some communication put forward. You know, perhaps we can package up our experience over the past 3 weeks and say, look, this is not working. You guys need to be more clear about what's going on here. That's something we can do. The letter that I was talking about with Commissioner Sweet is, you know, just a basic plea to the governor to say, look, you know, leaving the rural counties out is nonsensical at this point. And we really need you to get behind that package of 27.4 million, even though it's not as much.
would it make sense to gather city signatures also for that letter, or keep it separate? Because
The commissioner letter.
Yeah.
Letter. We were thinking the
just
20,
to add to it, or does that just make it too confusing?
we were thinking the 26 counties
Okay.
as a rural continuum.
I think it's 25 now. For some reason, they keep using the figure 25, but I don't know whether one of those counties has.
I'm not sure. I was always thinking 26.
Yeah, well, originally,
The
and then I
numbers,
saw the 25 somewhere.
the numbers are fluid.
Oh.
You know, and the other thing I want to comment on is briefly, because it's not why we're here, but there are a lot of different factors that contribute to homelessness. I'm looking back at this article that I talked about earlier with fentanyl. And there was one particular piece that is worthy of noting. This is from the Youth Substance Use Disorder Program Policy Corner at OHA, so DHS OHA. He was a juvenile behavioral health counselor within the schools for a long time. When he got to the state level, he got a bird's eye view of the system, and for the first time, he said, "Oh my God, look at the rural and the frontier areas and the need and the impacts that the opioid epidemic has done to the rural counties as well, and the lack of services there." So when we talk about houselessness, homelessness, there's a lot of different things that factor into those numbers, from addiction, from mental health issues. I remember reading earlier this week about the former mayor of Bend. And the article was about how he was a very successful civic leader, successful in business, and due to a series of mental health crises and breaks and addiction, passed away homeless, right? And that was the whole point of the article. It was incredibly sad. But you can see as you read through that, there are so many different nexus that go into this problem. And I won't forget Commissioner Myron from Marion County on that initial call. Yes, sorry, Multnomah County, when she said, number one, our point in time counts are not accurate. It is probably 4 or 5 times as worse in Multnomah County. But number two, her level of frustration that when we just throw money at housing, this term housing, but there's no wraparound services connected to it. There's nothing that connects it to mental health, to addiction services, treatment, recovery. We're just simply throwing money at the problem. And those are her words, not mine. She's an emergency room doctor. She goes into these communities all the time. She knows what she's talking about. And so there's this level of frustration from me about how it's not just about availability. We know availability of housing is certainly a problem. There's all of these other factors that go into our homelessness issue and the fact that the numbers continue to rise. And we also need to be aware as taxing districts that our actions as a city or a county, when we come up with, when we decide on certain things like SDC fees or local tax rates or fire department tax rates, right? We are adding to the pressure on households in our county that are then becoming more and more severely rent burdened, or they're on the edge, especially our senior population who continue to pay these constant increases in property taxes. So there is a lot on the table to discuss. It's not simply, we just need more money to build houses. There's a lot of it that goes into why these numbers are increasing. And I'm just not convinced that this particular option, the emergency declaration, is going to solve the problems, because they can't tell us whether or not we even will qualify for any of it. I just think we've already spent 3 weeks on this to try and get to the bottom of what's happened. What is the truth? What are we really looking at? We've done our due diligence and we got practically nothing in return. And it's very frustrating. So commissioners, we do have an emergency declaration in the packet, I believe, that we had drafted one. It's my understanding that if there is a consensus that we are going to instead focus on the 27.4 million and these letters that I've been talking about, that we don't need to vote. It's just a consensus to say, let's pivot for now, go forward with that. And then we can continue to watch and see what happens. I'll continue to reach out to the rural counties to see what they're doing, if they've gotten any success, if they're hearing anything new. But I think we've heard what we need to hear at this point.
Regarding process, in terms of voting, not voting, consensus on moving forward with a letter, what needs to happen next?
Each of those is an option. You can choose to take no further action if you're not going to act on an emergency declaration. You could take a formal action to also put on the record that the board has decided not to declare an emergency declaration, or you could decide by consensus and then a letter could come back later and be considered by the board. So each of those are options.
So I have a question, Chair, regarding the letter, which is basically a plea for the governor to take a closer look at what our needs are, and maybe we can submit some of the data. There is data, which is, it's not the point in time count, but it's very compelling. Here's the data. Here are the receipts. We have a need. Can you please retool this? If we've got the money that's allocated in this bill, but can we look at a more equitable way to dispense this money and bring that letter to bear on this in lieu of, at least for now, in lieu of a declaration?
Yeah, I don't know what that looks like. I don't know what retooling means. I'm not in charge of it. This is the state's thing. And this
We
is the
can ask.
governor, like I said 2 weeks ago, the governor could decide tomorrow that she's going to include everybody and ask the legislature to fund something else. This is not something we have control over. In the meantime, though, I will be reaching out to all of those 10 counties to ask them how much money they were told they're going to receive, because I can do math and I will add it up and make sure that I understand where we're at. Because if we're not going to get answers from them, I'll go to the commissioners. I mean, this is just, it's quite frustrating. So, but at this point, I think that we put the emergency declaration on hold. We continue to watch that plea with the governor through letters from the rural counties, and then have a plan and actively chase the House Bill 5019 and 27.4 million. I mean, we already know how we could spend $1 million if that's what it means. So I think that's the best course of action right now.
So no vote is necessary.
That's correct.
Okay, so I will ask for consensus from the board. If they are good with that.
Agreed.
Yes.
Thank you.
Thank you, everyone.
everybody. Appreciate your input.
Okay, do we need to take another quick break or should we keep going?
Keep going.
Okay, so that let's see, brings us to item H4, which is discussion of received applications for the Yamhill County Direct Impact Grant Program. This was continued from February 23rd of 2023.
So we had this item on the agenda, and what I was going to suggest based on individual conversations that we had, that instead of kind of going through a work session kind of exercise here, because I know there was a lot of applications to review, but if each commissioner would just submit your recommendations to me, and then Carrie and I will sit down and take those recommendations and then bring them back next week and see if there might be some that it clearly identifies that there's agreement, that we could get that organized into a spreadsheet and then come back next Thursday, put it up on the TV, and then we can have that discussion and see if we can come up with a final list of awards.
So is that clear? We'll send Ken our scoring.
Perfect.
Okay, so we will move that to next week. Let's see.
Oh, we're going to review it next week, but you're going to go ahead and submit things to me now.
Yeah, I can have
Yes.
mine later
Yes.
today for you. yeah.
Okay, item I is other business. I1, consideration of approval of agreement number 179210 between Yamhill County and the Oregon Department of Human Services for vocational rehabilitation job placement services in the not to exceed amount of $300,000 effective upon final execution through June 30th of 2025.
Chair, just a point of discussion, I asked Director Manfred if there was any sort of the outcomes of these, if there was an audit of jobs and placements and things like that, and she said she would get that information. But I would move approval.
Okay. Let's see. Okay, so this is regarding our mental health clients and supporting their employment opportunities
Yes.
specifically.
Mhm.
Okay. Okay, any questions on this item?
No.
Okay. Commissioner Sterrett moves approval. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Motion passes. Okay, item I2, consideration of approval of the appointments of Christy Cook and Brian Everest to the Planning Commission, each for a 4-year term to expire on July 1 of 2027. So commissioners, I went through all of the paperwork that came to us, watched the audio or listened to the audio of the meeting. And I think the applicants were really, really great. And it was glad to see the 5 of them come forward and apply, and we should certainly appreciate that. The scoring, I guess,
Yep, score
the
sheet.
feedback is what I would call it from the planning commissioners. They were all very close. And at this time, I would like to move approval of Christy Cook and Craig Brown to the Planning Commission. And really my reasoning is because I want to see some folks that have a little bit more experience in Yamhill County. They've been born and raised here, they have businesses here, and are deeply rooted. And so for that reason, I move approval of Christy Cook and Craig Brown. Any further discussion?
Done.
Okay. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Great, thank you. Okay. Item I3 is consideration of opening a sealed bid for tax lot R4414-03590, county-owned tax foreclosed real property. And we've got an update on this one.
So this is property that's actually just to the south of the one that we accepted bids on earlier. Also on the river, also adjacent to property. We did reach out to the property owners requesting a bid. And I am hoping that's who this is from, but I don't know because it's not open. So is there any questions before I open it, or do you want me to go for it?
Have you ever wanted to put
So
those over like
excited.
theme and like?
Yeah.
And this
Really
is the
just
perfect
don't care.
size, by the way, to be a singing like letter.
Again, if you ever do that to me, I hope you end up with really bad property. Okay. So it looks like the owner just to the, what is that, east, I guess, is called Sarbanan Enterprises. It's a company. So let's see if that's who
They own a
sent
lot of
this.
farm.
Am I saying it right? Oh, okay. It is from them. Sarbanan Enterprises, and they bid 17,500.
17,000.
So just above the minimum.
It is above the minimum, so that is above minimum. Thank you.
And do you have a map of where they are as a?
This is the one that just did.
But you said they're adjacent owners?
Yeah, so this is,
Hmm.
they own all that's right through here. And then this is Dancing Bear, so Evergreen Aviation Museum's over here.
Gotcha. Okay. Well, if it's above the minimum bid, that makes sense to me.
There's the Evergreen property.
Yeah, so Evergreen's over here.
Mm.
This is, that was called Mother Brothers, but they own all.
Mhm.
So this-
Okay, thanks.
Okay, so I move approval of the sealed bid of $17,500. Is there further discussion?
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Great, thank you. Yay, we're getting some of them done.
I should have deeds to you next week. Yes, I will have them to you next week. I will make it happen.
Like
You.
Monday or Friday? Anytime is okay to sign.
Well, no, it'll have, no, so it'll be in front of the board next
Oh, okay.
Thursday. Yeah, and then we'll figure the
approval.
signing out after that.
Okay,
Actually, now that I just said that, we're actually gonna have to wait because we need to get full payment from both buyers. I think from Mark, we'll just need a recording fee, and then from them, I think they only gave 10%. So it actually might not be next week, but as soon as I can get them in front of you, it'll be here.
great. I'm glad it worked out with neighboring
Yeah.
owners. It just
That makes
feels
me
so much
feel
better
way
to.
better. Yep,
Mhm.
I agree.
Okay.
Also, since I have the floor. Oh, Dad, is it okay if I schedule an executive session next week to talk about surplus property?
9 o'clock.
But it might be dual purpose depending on.
Okay,
Yeah.
yeah, all right.
Okay.
My apologies for taking up the floor.
All right, moving on to item I4, consideration of approval to amend the payroll policy on employee expense reimbursements. And I believe, have we all talked about this individually? No, okay.
Not necessarily. This is a requested revision on how we process expense reimbursements. They've always been processed through AP, but paid through payroll, which is for those who work in ERP systems will know that that's two completely different process. So we have to process through an AP account and then we actually pay it through payroll under our current policy. That slows down getting expense reimbursements as we receive those. And with our new conversion to Oracle, it makes much more sense to fix this and start processing expense reimbursement requests that come from our employees in a much faster fashion. And because they're not actually a payroll item, they're not taxed, that we'd like to roll out this change. It was more of a system change, but we found the way our current policy is written, we said we would do it via payroll. We would like to start the process of effective 14 days after approval, giving an additional day to make sure we have enough time to also do a notification out to all employees on this change. But we'd like to modify the policy to then process all expense reimbursements through AP. And that's all we're doing. There's a lot of benefits with doing this. We think it's the employees that have expense reimbursements don't have to wait to turn it in with their timesheet. They can just submit the form and we'll process during all of our accounts payable for that week. So we're looking at a much faster turnaround on addressing expense reimbursement. I know that was a lot of explanation for just one little line in our policy, but
Yeah, makes sense though.
But and the reason we're not bringing the full policy forward is with the implementation of Oracle, there are going to be some process changes once we get the HCM components implemented. And what we'd like to do is once we are fully implemented with the full system, then we'd be doing a review of our policy and procedure around AP, AR, payroll, like all of our accounting functions. We would bring that back in one batch. But this was one area that we'd really like to start processing expense reimbursements right away. And that's why we're bringing this minor adjustment to our policy right now.
Okay. So commissioners, I will move approval of item I4. Is there further questions or discussion?
No.
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Okay. I5 is consideration of approval of intergovernmental agreement number PO 25700-0016109 between Yamhill County and the Oregon State Fire Marshal's Office for the development of a pilot program to emphasize wildfire community preparedness in the amount of $10,000 effective upon full execution through June 30th of 2023. And Sergeant Young is here. I did have, just a question about how this sort of relates to our experiences over the past few years with, the Labor Day fires and all of that and what it all means.
Yeah, okay. Thank you for having me. Good afternoon.
Thank you.
This one will be a lot easier than the previous topics.
Yeah.
If I had even thought, I would have suggested that we move this
I
up
know.
because there was so much going on anyway. Apologies for you basically spending the whole day here.
No, I appreciate you letting me do it because it's not a process that I see a lot of all the time. So, hey, how we work.
Yeah.
So this stipend, which is kind of cool because it's not a grant, it's not a reimbursement type agreement that we enter into where we pull out of our general funds or whatever to get a reimbursement in the future. This one came as to Oregon State Fire Marshal's Office after the Labor Day fires of 2020. And they spun up these regions, which is really how some of these state departments are going right now, going to regional coordinators. So we are part of this Willamette Valley region. And I believe there's 6 counties total in it. And what they did and what the coordinator for that region suggested is this pot of money that came from the legislature for these pilot programs. She wanted to develop it and allow us to do these evacuation educational type things. Some of the things that we could have done were developing evacuation plans, purchasing and outfitting go kits. But I think when you start looking at developing plans and bringing in items, things, stuff, where do you store it? And who's the go kits for? Is it employees? Is it for the general public? I mean, $10,000 will not go very far for a whole lot of people for go kits. So we ended up landing on a project where we want to get evacuation education materials out to the community via mailers. So we did some initial research on it, and we can hit a large majority of the population for Yamhill County through the U.S. Postal Service programs that they have for direct mailing. What we decided as we started looking at the maps that are part of their program, really we're hitting all the small cities with the cities included and the PO boxes within. And the only people that really are left out of this push, which is really more focused towards those that have more exposure to the wildland fire scenarios, are the folks that are in McMinnville and Newburgh proper, the city, the internal cities and the PO boxes there. It would have just been very more expensive than the budget that we had. So we get the outlying folks and the folks that are more tied to that rural setting or forested setting where they're going to look at maybe those evacuations. So we are partnering with Polk County in this. A lot of our southern fire districts, southern end of our fire districts, dip down into Polk County. And we have a lot of residents, like Willamina, for example, is kind of this dual county city. So what do? I work with emergency manager Dean Bender there quite often, good relationship, and we're close in what we do. So we're going to pilot with them or work with them and develop this same flyer. And he's going to send it out to the Polk County residents in the same manner as we're sending it here. So we've got the potential to, with the $20,000, his 10,000 and ours, have the potential to hit a lot of people.
Okay.
I think that's a great
Sounds
idea,
great.
because we've had, projects and programs in the past, but we really haven't gotten and be able to get in front of people. Will it include a link to prevention or workshops or anything online like OSU?
Yeah, in fact, Carol and I just had the conversation this morning about the design and obviously the focus and it's in the contract, the focus is on the evacuations, the ready, set, go and what that means. So on the flip side of this, it would have those exactly what you talk about, Commissioner, about the links that, hey, visit this site for more information on preparedness, that would be like ready.gov or something like that, or the Firewise on the defensible space, or things like that. The OSU video series that they put together, and things like that. So yes, long answer for yes.
Great, that's great.
Yeah, and during the Labor Day fires in the cities, at least, I mean, it was air quality. It was more of those issues, which is significant, right? You want to know what that does if you're out in it. Of course,
Oh,
we were out in it.
Yeah.
for days,
Yeah,
but,
absolutely. Absolutely.
And so perhaps that's another avenue for education, but yeah, this sounds great. Any questions, Commissioner?
No, thank you.
Okay. Thank you,
Thanks
Sergeant.
for working with
Thank-
us on this emergency declaration.
Yeah,
I know you put a lot
Lot of
of time
work.
into it.
Yeah. My pleasure, I guess, my job.
My
So
job
I'm
is
happy-
my job.
I'm happy to help. Let me put it that way. Thank you, Christian, for all the
the typing.
legalese and putting my gobbledygook into legal form. Yeah. Awesome.
Thank you.
Thank you.
Sergeant.
Thank you.
So I will move approval of item I5. If there's no further discussion, all those in favor signify by saying aye.
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 All opposed, same sign. Great, thank you. All right, item I6, consideration of approval of temporary, permanent, and utility easements for 4 property owners adjacent to the Gopher Valley Road Bridge Replacement Project in the amount of $3,400. And commissioners, I did double check. Anytime we talk about easements, I want to make sure that the property owners are on board and supportive and there's no issues. And so I did double check that. There are no issues. They are they've been very cooperative. They've signed off on all this. And in fact, we're helping one of them with their own personal bridge on their property over the river or creek. So, I don't have any other questions or discussions. Anyone?
No.
Okay, so I will move approval of item I6. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Thank you. Okay, item J is public hearings. We have nothing. And item K is announcements. It looks like there's a sort of an additional announcement on here that was italicized. Commissioner, if that's something, I don't know if that's your
Yeah, just.
senior
once-
advisory.
Yeah, once again, Northwest Senior Disability Services is broken up into a number of different counties, and Yamhill County is always in a deficit of their Senior Advisory Council and Disability Advisory Council. So if anybody's interested in those positions, the link is on the website.
Okay. Did you have any announcements?
I got one. So Water had their native plant sale. They did really good, grossed
Oh,
about
yeah.
85 grand.
Wow.
They got a few plants left over. So if you guys, anybody needs anything, call
Yeah.
them. They're gonna have maybe an Earth Day sale to follow up with
Okay.
the extra plants. So yeah, they were super excited about that.
Yeah, it was a really beautiful mailer that they
Yep.
put together for the sale, so.
Yep.
Okay, so I have a few announcements. I participated in Medford on Friday for the ONC County, it's a quarterly meeting. And I sent Carolina a picture, because I have been told that I need to help educate my board on what ONC counties mean and what we do and why we're a part of it. So I don't know if you have the photo handy, but it shows the commissioners that are involved. Not all of them. There was only 12 of us there, but so
Are we waiting for a picture or?
quick update on that. So ONC is the Oregon and California Lands Act counties. There's 18 counties, and we, through this act, we receive 50% basically of the timber sales revenue from ONC land. So if you look at a map and it looks like a checkerboard, that's typically ONC land. The BLM manages the land. And so we receive what's called SRS payments, Secure Rural Schools payments, each year. And we will be coming up here pretty quick in terms of choosing how we receive that this year. But it essentially goes into helping to pay for schools and different things in rural counties in lieu of having control over managing the forests in those counties. So
Was this the same program that the state of Oregon sold the Elliott Forest? Was that part of the ONC lands or is that something totally different I'm thinking
I
about?
think that's different.
State.
But it
forest,
went
yeah.
to the schools fund, right?
That's a different, that's
Okay,
different. Those are
totally
the
different.
state,
This is federal.
it.
yeah.
So lots of discussion. Essentially, we as a county back in, I think I said 2015 or 2016, decided to join these ONC counties, and together we sued because the BLM was not harvesting at levels that were that they were essentially dictated through the act to do. So fast forward, the lawsuit is now in federal district court, as I understand it. It's Judge Leon out of Portland, I think. And he ruled in favor of the ONC counties. However, the BLM is just assuming that they are going to win on appeal, so they are not changing their practices. There you go. There's all of us. We're in the faux White House. There's like a Oval Office mock-up in the Medford Airport. So if you're ever in the Medford Airport, it's way in the back, and you can go in there and take pictures. Anyway.
Who's behind the desk?
That's Doug Robertson. He's the new executive director of the ONC group.
Yeah.
So, where was I
Yeah,
at? So,
crazy.
so anyway, BLM is not doing what they're supposed to do, and they're part of the Department of Interior. And unless the Department of Interior tells them to do what they need to do, they won't. And they think they're going to win on appeal. So the next step is to go through the appeals process. I believe it's already been put in front of some of those appellate judges. We have no idea when the decision will come down. But if it's favorable, great. I suppose we have still have the same problem of what is BLM going to do in response. But if it isn't favorable, then we talked about, and you attorneys need to get my lingo right. It's a cert or petition the Supreme Court.
Petition for certiorari. Yeah.
Okay,
That would be
petition for
after
cert.
a Court of Appeals decision. though.
Right,
If
okay.
it was just at the district court level, then it would go in federal court, Ninth Circuit, Court of Appeals. And then that decision, you could submit a petition. A very, 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 very small number of petitions actually get granted by the Supreme Court. So they take a very, very small percent of
Right.
the petitions they receive each year. But if there is a difference among the federal circuits, those are the kinds of cases that generally the court will consider. Don't know what the facts or the issues are exactly in this case, if there is a split or not. But yeah, the next step would be Ninth Circuit Court of Appeals.
So we discussed that option if it comes to that. They have an attorney that has successfully petitioned the Supreme Court before on forest land issues. And given the gravity of, or the magnitude, I guess, of this, who this affects in this region, they feel strongly about it. But obviously it's petitioning the Supreme Court comes with a hefty price tag. And so they are putting together an official ask of each of the 18 counties. We have very little, land in Yamhill County. So our percentage of all of this is extremely small. The quote was about $300,000 to petition the Supreme Court in terms of legal fees, which I think is actually kind
For
of
just our,
low from what I was expecting, but
for just our portion?
no. Total.
Okay.
Total, all 18 counties. And so that puts our portion at roughly $2,123. Yeah, no. So previously I asked him how much we had paid before for the sort of the initial litigation. It was $3,299. So it's actually lower than we initially paid into this. But we will be needing to make a decision on that fairly soon because they're kind of banking the legal fund now and starting early in case this is a possibility in the future. And some counties like Douglas County have a huge portion of these fees. So they may have to divide it up over 2 fiscal years, to make sure they can absorb the cost.
How much do we receive from ONC?
Oh, I'd have to go look. Yeah, it varies on the harvest levels and all of the revenue, all of that. So that's something I will probably, when I get a more, firm number, and an ask from them, I'll bring that forward and we can discuss, since we're having budget talks, we can discuss where that might come from if we consider that. What else was it? Oh, so we've been talking about a code of conduct discussion. I think what I want to do with that, I'm almost done sort of compiling the sections I want us to talk about, but I'd rather start with a high level discussion on, each of those topics, I guess, before we hand it over and just say, hey, put the legalese to this. I want to make sure we're on the same page first. So I'll bring that up next week, just as a kind of a high level, summary, and we can talk about the different sections and I can talk about why I think they should be included, but I just wanted to have you guys expect that for next week, if that's okay. Commissioners, I wanted to ask that here's my feeling, since we just now approved the new planning commissioners, they are slated to hear the massive zoning code discussion at the beginning of April, in the April meeting, which doesn't provide them any meeting to, get in there, get their feet wet and learn about the process and anything. They're just going to be, dumped right into this huge discussion. And so I don't think that's fair. I would like to push it to the May meeting and let the planning commission know that, these folks need to have a little bit of time to get used to their new roles. It's a significant role. So if there's consensus, I want to make sure that there is before I email, Ken Friday and say, hey, the board really wants this to be pushed to May.
Yep, and maybe along those lines, have them send the packets out to him. He may do that already, but just so they can start doing their homework on it.
Sure, yeah. Okay.
Yeah, in terms of.
I'm sorry, I got pulled another direction. Can we clarify? Because I thought I heard direction being given to Ken Friday on something. So, and I want to make sure I have an understanding.
So there was a notice sent out. I think it goes to just the planning directors, planning commissioners. But anyway.
I got one in the mail.
Okay.
Public
That
notice.
that there's discussion about that large sort of direction we gave to talk about zoning code amendments to allow roads in all the zones and justification, that whole thing. It was put on for April, I don't know, 6th, 5th, whatever it is. I don't think that's fair to have our brand new commissioners just dumped right into that, because that will be their first meeting since we just approved them. So I would like that to be moved to May to make it more fair for them.
Okay, I can talk to Ken about that.
I have a question. How much, and you would know this, Kit, how much onboarding, if you will, is done to give a new planning commissioners an idea of what their expectations are and some of the basic information, nothing? Here you go, here's the information, now make a decision. I'm wondering if we could maybe look at.
That's the only reason I say, and Ken may do it already, but get them the information tomorrow, email it to them, be like, hey, this is on the docket. Start looking at it.
But I don't know if there would need to be something more introductory to that to give them more basic information.
I don't know. I mean, I'm looking at the calendar going, that's 2 weeks away,
Yeah.
so. It
I
doesn't
had
feel very
zero
fair.
onboarding. It's, here's your chair. Start listening to testimony.
Okay.
What do you think?
Well,
Based on, your personal experience and what you've dealt with before with land use.
maybe Ken has more of an maybe a suggestion as to what he could give them to read, or maybe, specifics in Oregon land use or county ordinances or anything specific that would give them a base coat, 101.
Well, I think much in the same way that, Ken and the team do when we have, items that come here before the board. I mean, they're always ready to assist, answer questions.
They're the ultimate expert.
Right.
So
Yeah,
it's-
okay.
Provide advice,
And
and
they
then
will
you
guide
have the
you.
other planning commission members
Yes.
as well.
Yeah.
They have the ability that if they have questions or have things that they can do, much like we hear, you move it to old business and continue an item to the next meeting. I know it's a little bit different with land use hearings because sometimes there's timelines associated with that, but
Ken and Lance are very good at answering questions on the fly. If
Mhm.
somebody has questions or, I'm not super concerned about onboarding, I guess.
Okay.
So yeah, it'd be April 6th, I think is the next one.
So we'd want to delay till May.
That's my suggestion. I mean, I plan on being there, so, I can,
I wonder if the hang up, because I got notice in the mail. So
Mhm.
for April 6th meeting for this specific thing. So now it might be a notice all over again, getting
Correct.
mailed out, and that might be the hang up.
well, we postponed it before,
Right.
actually twice, I think.
Okay.
So, but if that's,
I'm okay with delaying it. I mean, knowing the board and needing more time to. do
well,
it.
another option would be that they just decide to delay it when they're there on April 6th. I mean, they don't have to make a decision. That's not our expectation. They can always say, look, we can start the discussion, so.
I've noted the concerns based on the discussion and I'll have a conversation with Ken.
Okay, I think that was pretty much it, other than kudos to Kennedy for her
Oh, that was
Um,
so cool.
her performance at the state legislature and
That
the
was
House
wonderful.
floor. That was awesome. And
was
she
so
was
cool.
so calm and cool and collected. Like it just didn't even phase her. She wasn't nervous or anything.
She is getting so much better. And I think it's her teaching. She's teaching violin and piano now, and she's got, I think, up to, and I'm sure mom will correct me when I get home, but I think she's got like 24 students now.
Wow.
It is super cool, and she's getting to be, because she has to interact with her students, I think it's helping her a lot. too.
Yeah.
But yeah, handled it.
Yeah.
Smooth.
Like a
Of course,
pro.
she's so confident playing too. I
Yeah.
mean,
I
That
took
was
the,
super neat.
I took the actual live performance around the building and went into everybody's office and let them hear. It was really very entertaining.
Okay, well, I think that's about it. Anything else for the good of the order?
I had a meeting with the Ormond Fredericks, Oregon Department of Human Services regarding youth in foster care, and that's an ongoing discussion and doing everything we can to keep the 80 to 100 kids, keep that number down, get them in, get them out, keep them from going in, and addressing some of the kids who are aging out of foster care because they're the ones who are homeless.
Right. Okay. Well, I will follow up with all of the letters that we talked about and, get those on for next week.
Thanks, everybody.
So
Thank you all.
thank you. So I will adjourn the Yama County Board of Commissioners formal session for March 9th, 2023, and it is 2:05. Thank you.